With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
Be healthy. Be informed with ITD.
Habiba islasen para honra, para gloria. Habiba islasen para todo y tempo y paz para ita dan gini langit na bendición contra y peligro na fan sa fuham Deus protegis languam contra y peligro na fan sa fuham Deus protegis languam.
Driving round, windows down, warm breeze and a soulful sound. I got my mind made up about where I wanna be. Can't nobody take my home from me. There is no place like home. Saying goodbyes to how gone. And I'm proud of where I'm from.
Good morning.
Yeah, there's no place like home. The palm trees sway.
May the 4th be with you. It's a Star Wars thing.
And I didn't get to watch it.
You're wearing kind of like a Star Wars-y kind of outfit there, though.
Yeah, I'm a Star Wars fan.
You're like Sith. Are you going Sith Lord today? Hold on, I think I need to go get my wand on the next break.
Oh, you forgot it.
I got a feeling this is going to be a wand day. Okay, yeah, be good, sir. Wands Day. It's a Monday, the 4th day of May, the year of our Lord, 2020. And welcome again to the KWAM News Takeover, Guam's favorite containing COVID. My name is Chris.
And I'm Sabrina.
And good morning, Guam. Hey, so many ways that you guys can catch the show. Of course, right here on the radio, 93.9 FM also. There's an audio stream, Docomo Channel 10. We're streaming on KUAM.com and the KUAM News app. 8 o'clock, we jump over to KUAM TV 11, and we bring the show right into your house. Okay, for the last 2 hours. And last but definitely not least, you guys make our morning every morning. To our Facebook Live viewers on KUAM News, we've got a big, huge show for you guys today. At 6:20, just some of the people we're expecting to call in this morning. Lieutenant Governor Josh Tenorio. We're going to try that again. Okay, he sent me a message over the weekend. He let me know how he felt about what happened at last week's press conference with the muting of the media. Mutegate. Got to come up with something, the muting of the media. And yeah, so basically Lieutenant Governor was like, he was blindsided. He did not support what went down. But, you know, I want to let him use his words to speak on that. And so we had tried this last week. However, the Lieutenant Governor had to go sound check for the Island Sustainability Conference, and there was a whole crazy chain of events that happened. So we're back here Monday with renewed purpose to get the information you guys need, and there is a lot of it. So, yes, also this morning we're going to be talking with the legislature's procurement oversight, Senator Sabina Perez, to talk about the new way, the reinvention of emergency procurement under the government of Guam. Yes, there's a new sheriff in town, and he's called...
There's a new way to procure?
There's a whole new way to procure, and, you know, it involves the Attorney General giving you a green light all the way, and then, you know, the governor's legal counsel is calling a lot of shots, and we're just trying to put it all together. And let me tell you, there's a lot of pieces, but we're going to do our best. You know, when you have a jigsaw puzzle
Yes.
First thing you do is you lay out all the pieces on the table, and then you start flipping them over, and then you get your edges. So I would say right now we're getting all of our edges. And so there has just been a lot of developments with this hotel quarantine procurement, I guess we'll call it. And we're going to find out what your legislative oversight procurement has to say. And the senators got a lot to say about this because apparently there was a big meeting that happened over the weekend. So, yes, we got that. We also got an update for everybody waiting on the PUA and the FPUC. We have an update from the Department of Labor this morning.
You like saying that, don't you?
I saw you on the corner of my eye, and I thought you were over there like, yeah, we got that update. We got that update. So, yeah, we got that update.
Oh, my God.
For you guys. And then also, there was some big news out of the Catholic Church of Guam. Viva Santa Maria Carmelin! Viva!
That was amazing.
We needed that.
Yeah, that was really beautiful just to see. Then they live streamed through the villages. Oh, my goodness. I had to share it. I was like, everybody has to see this.
This was amazing. It was so awesome to see the island come out, and to come out with their masks and, following all the rules that the governors put down, and to just see everybody come out and welcome the protector of our island, Santa Maria Carmelin. That was just amazing. And it also came on the heels of some big news from the Archbishop, Michael Burns. And so we're going to get Father Paul on to talk about that. So like I said, it's a huge show for you guys this morning. Please share, watch, question, comment on the broadcast here, and we'll do it for you guys. It's 6:23. Hey, so as we always do, we start the day with a deep dive into the COVID-19 headlines. And from the KUAM News team, Sabrina Salas-Matanani. Good morning.
Hafide, good morning, everyone. Over the weekend, a total of 250 tests were conducted and a total of 4 returned positive, bringing the total number of confirmed cases of COVID-19 on Guam as of Sunday night to 150. The samples were from clinics, hospitals, the quarantine facility, and expanded testing at the Hemlani Apartments in Harmon. We should note all of the samples taken at the Hemlani Apartments were negative. Additionally, according to the Joint Information Center, at least 5 people who had initially were determined to have recovered from COVID retested positive for the virus and are back on active isolation status. Governor Lulian Guerrero's former chief of staff isn't the only high-ranking official who was allowed to stay at the Pacific Star in Tumon. KUAM has confirmed that Guam Energy Office Director Rebecca Respicio, Guam Housing Corporation President Alice Tyron, and Guam International Airport Authority Deputy Executive Manager John Kanata are also staying at the Tumon Hotel. According to documents obtained by KUAM, the Pacific Star is being used as a quarantine/isolation facility by the local government. Governor Leon Guerrero's Director of Policy, Carlo Branch, says Respicio and Tyron staff the quarantine site 24/7. Quote, this is because regular hotel staff are not permitted to have contact with quarantined individuals. At present, that means being the only overnight staff for 140 individuals. If a person needs food, blankets, or has a problem in their room at night, it is Rebecca and Alice they call for help. It's also important to note that while arrivals are much smaller, inbound flights to Guam still occur requiring quarantine. As for GIAA's Deputy Executive Manager, Branch says, I cannot comment on matters related to HIPAA. According to the Centers for Disease Control and Prevention, isolation separates sick people with a contagious disease from people who are not sick. Quarantine separates and restricts the movement of people who were exposed to a contagious disease to see if they become sick. Tony Babalza resigned as chief of staff on Friday following a whirlwind of controversy related to his one-night stay at the hotel. Public Health Director Linda DeNorsi was on KUAM's Containing COVID radio show earlier last week. She said she had received a call from Babalza saying he wasn't feeling well. Because of his concerns that he has elderly family members living at home, DeNorsi allowed him to stay at the Pac Star. She could not say how long he was allowed to stay or whether he had been tested for COVID. The governor's communications director, Janela Carrera, later told KUAM it was only for one night. Between the period of March 23rd through April 5th, Pac Star billed the Department of Public Health $544,600 to rent 389 rooms for 14 nights at $100 per night for use as a quarantine isolation facility or a non-congregate shelter. Last week, the Bureau of Budget and Management Research sent a letter to Speaker Tina Munoz-Barnes informing her that it would be returning $7 million that it transferred out of various government agencies to pay for mandatory quarantine protocols and a temporary hospital program. The letter signed by BBMR Director Lester Carlson stated they would instead use federal CARES Act money. The Federal Emergency Management Agency, FEMA, in the meantime, has approved Public Assistance Program funding for costs related to emergency non-congregate sheltering between March 21st and April 20th. In a letter from FEMA Region 9 Administrator Robert J. Fenton to Territorial Coordinating Officer Charles Esteves, he also informed the local government that they would also extend costs for reimbursement until May 21st. Fenton wrote, however, "I would like to reinforce the importance of GovGuam maintain effective tracking mechanisms to provide sufficient data and documentation to establish the eligibility of emergency NCS costs for which it is requesting PA funding. This includes the need for emergency NCS of each individual, length of stay, number of meals, and other services provided. As with any activity, lack of sufficient support documentation may result in FEMA determining that some or all of GovGuam's claimed costs are ineligible." The government's plan to open a homeless shelter this past Saturday at the Paseo were scrapped. According to Adelup, based on recent information garnered from similar projects in other jurisdictions, the site for the Safe Haven project was determined not to be conducive to limiting the spread of COVID-19. It's been over 1 month since the governor announced she was working on a shelter for the island's homeless population. A few days ago, restrooms were being fixed at the Paseo and the baseball field was being prepped. FEMA spokesperson Frank Mansell told KUAM GovGuam had requested the federal agency to provide tents for the homeless shelter at Paseo. He says, however, a determination was made that it is not an allowable expense. Adelup says site alternatives are being immediately considered in order to safely accommodate the vulnerable population as quickly as possible. On Saturday, thousands watched online and on KUAM television as Archbishop Michael Burns held a special early morning mass to reconsecrate our island to the Blessed Virgin Mary. During the mass, the Archbishop made the announcement about outdoor services.
This coming week, we will have the opportunity in the parishes for which it is possible to have Mass, congregate in a parking lot, and to receive communion from their cars. So I just want to make this known at this point, in just that it's another ray of light for us here on this island. And we're doing this in cooperation with the Department of Public Health, and just wanted to acknowledge that as a church, we have a strong desire to be partners with our government, recognizing that we have an extraordinary responsibility to see that our efforts in the church don't become an instance of widening the scope of infection here on the island.
Abuse and active COVID cases, 3 of whom are hospitalized at Naval Hospital and 53 have recovered. Reportedly, the number of sailors who initially tested negative but now testing positive has increased. During a Pentagon briefing over the weekend, spokesperson Jonathan Hoffman says a more in-depth investigation is being conducted to determine how the virus got on the ship in the first place. 2 weeks after abruptly ending its rotating bomber presence in 6-month intervals at Andersen Air Force Base, Stars and Stripes is reporting that 4 B-1B bombers and about 200 airmen from Texas are on Guam to conduct training and operations with allies and partners. The last time B-1s were deployed to the Indo-Pacific region was 3 years ago. In national news, President Trump missed the aerial show. After 34 days at the White House, the president has retreated for a working weekend at nearby Camp David. As Nicole Killian reports, he missed some frustrated truckers.
Outside the White House, big rigs parked, honking mad.
We're just small carriers that's just trying to make it.
Truckers protested against low freight rates and wages, looking for help in the next stimulus package.
What we're doing is we're waiting to see what the economic impact of the gradual opening up is.
The relief package, which could be at least $500 billion, is likely to top the agenda when the Senate returns to work Monday. But safety is too. After a reported warning from the Capitol physician this week about a potential shortage of coronavirus tests for all senators, Health Secretary Alex Azar announced on Twitter he's sending 3 rapid testing machines and 1,000 tests for use. President Trump, who has been tested multiple times, tweeted, "There is tremendous testing capacity in Washington."
It's really a very promising situation.
Friday, the president touted the FDA's emergency approval of remdesivir after a preliminary study showed the drug cut recovery time in COVID-19 patients by an average of 4 days.
The data shows that remdesivir has a clear-cut, significant positive effect.
The House Appropriations Committee accused the White House of blocking task force member Dr. Anthony Fauci from testifying next week about the government response. The White House argued it's counterproductive.
This notion that the White House is blocking Dr. Fauci just doesn't bear in truth.
Back to those tests for lawmakers, House Speaker Nancy Pelosi and Senate Majority Leader Mitch McConnell put out a joint statement respectfully declining the administration's offer, saying Congress wants to keep directing resources to frontline facilities. The White House says it's their decision to make. Nicole Killian, CBS News, the White House.
And finally, in your Banking 671 report from Bank of Guam and Coast 360, island residents who receive their stimulus checks, or when you do get your stimulus checks, you can cash them even if you're not a member at Bank of Guam, Bank of Hawaii, Bank Pacific, and First Hawaiian Bank. That's your Banking 671 tip from Bank of Guam and Coast 360. Chris.
Well, thank you very much, Sabrina. As always, a deep dive into the day's COVID-19 headlines, and there's just a lot to unpack about this whole Pacific Star Hotel quarantine, but we're on it and anticipating that, boy, it's going to be a tough press conference for Antelope today.
Yeah.
Yeah. Because we still haven't, and I can see the strategy of it. Thursday was just such a nightmare for the administration that they basically went into hiding for the last, Friday, Saturday, Sunday. And now it's kind of time, we're thinking, to face the music. Mm-hmm. And so you got to wonder...
Unless something big comes out between now and
I think
press conference.
I think the administration is going to...
Something will be announced at the press conference.
Yeah, that's what I'm anticipating. They're going to announce some big plan. They're going to try and probably give you guys money or something just to distract from everything that has happened. But what I'm wondering is if they do that, is it going to be a similar situation to the recovery plan where they're like, hey, look at this awesome plan we have, and the media is going to be like, yeah, right, but the people want to know where the aid is. Or, so we'll see. 6:38. I want to bring Dr. Peter Lombard on here. He's been studying COVID. He's got some really interesting Facebook posts. And hi, Doc. Good morning.
Good morning.
Hey. Good morning. How you guys doing?
So there's just so much going on, and I was kind of thinking this weekend that everything you don't want to do wrong in a pandemic emergency response, it kind of seems like the administration is doing wrong twice. And so I was talking with somebody over the weekend, and it kind of seems like on the non-medical, just nothing to do with public health and the response with the testing and all that, and, the actual, what is supposed to be the actual COVID-19 response. There's just been so much nonsense going on with, staffers staying at quarantine hotels, the whole thing with the chief of staff, just, the muting of the media. And so what I think that has led to is nobody has any trust or confidence in a lot of what is coming out of the government of Guam. Mm-hmm. And now I'm feeling that with the latest news this morning that we had 5 recovered, was it 5 or 6?
I think it was 6, yeah.
6 recovered patients now testing positive for coronavirus. I think that people have been kind of, talking about these test results and, there's all negatives. Wow, that's crazy. And now I think with this latest news, it's almost like the last thing that people could have had faith in, which is the science of fighting this virus. It's kind of out the window now because everyone's kind of saying, well, we're saying these people are recovered and now they're testing positive. So how do we even trust the whole process, Doc? So I want to just start by getting your thoughts on that.
Yeah, that's unfortunate. I mean, because I think there's, if you look at other countries, they've been seeing the same thing. So while I think there are reasons that and ways that you can explain how this happens that are rational, and we don't know all the information yet why this is happening, but it's certainly not unique to Guam. But your point is well taken. It's going to be harder to have that conversation with people and try to get them to understand that when there's already mistrust. They're gonna think it's for other reasons, that it's everything's being mishandled, the testing is being mishandled. But you are actually seeing that other places as well, and there's probably there could even be a few different reasons why that's the case. And without knowing more details about each case, it's really hard to speculate. But you could say somebody tests positive again, whether or not, if they have, let's say they get symptoms again, they recover, they feel fine, they get some sort of symptoms again that cause them to be tested. We've talked about these dead viral fragments that can live in your respiratory cells, and then your cells get shed over the course of weeks and weeks and weeks, and as you shed those cells, they can be picked up with the swabs. So you might be picking up virus that's inactive virus, and the patient may actually be presenting with an illness or a new virus that has nothing to do with their original infection. So that's one potential explanation for why this is happening. It is possible too that people are reinfecting if they did not mount a strong enough antibody response to the first infection. At their antibody levels, they have some, but not enough. And if they're exposed to it again, or there's some reactivation process in their body where the virus wasn't fully defeated and it comes back, that's also been speculated. But most of the latest studies that I've seen have pointed to, if people are testing positive later, it's due to sort of these inactive viral fragments that you're just kind of shedding over time. But again, that discussion is kind of complex, and I think people are gonna again just question because of the lack of trust that's out there in general.
Yeah.
Mm-hmm. Do you think a lot of the people that have been released on home isolation, that they probably should have gone to the government isolation facility so that they're more monitored?
Necessarily. I mean, I would say what we don't know is what the public health has been telling these people at the discharge. If they know this information, if they're following the studies also, they might be telling them, hey, here, just a heads up, this might happen. If you have any symptoms, make sure you get in touch with us. And just to be safe, make sure you're a little extra careful with your own, social isolation practices. And so I don't know, maybe they're telling that to everybody, or hopefully they're certainly doing that now. But yeah, and it sounds like they have not seen anybody get reinfected either. And that's, or I guess what I should say is the people that are testing positive, they did mention in the report that nobody has been has caught the virus from them on their, sort of their second go, with the infection, if it is indeed another reactivation or another infection in their case.
Yeah, and they could be from the same household. We just don't know.
Yeah, and I think that it goes, something that you've been very consistent on in your Facebook posts is calling for transparency, which is nothing new, but the kind of transparency you're talking about is with the testing, who's getting tested, not names, but obviously, right, if these recoveries are now popping positive, we want to know what caused them to be tested again.
Yeah. Did they have symptoms? Was it just the patient had a hunch and say, hey, I'm just feeling like I'm not completely better.
Right.
What criteria are they using to retest people now that they have expanded testing criteria? Maybe they'll take these folks even if they just have a hunch that something's not quite right. And then not just for these, but for the 15 or so cases we've had in the last 15 days. Again, what do we know about these folks? Do they have prior contacts with other positive cases, or are they just people coming off the street and we have no idea, where their infection came from? Because that kind of information is, really would be really useful for the public to know,
right,
in terms of how much wild coronavirus is out there versus related to clusters or pauses that we already know about.
Right, because see, what happens is when they put this information out so late at night, I mean, what happens is there's a lot of anxiety out here now, and we're just marinating in it because there's no word from the government. They should have, public health should be calling all the media this morning and saying, hey, we just want to give you more info on that because, people are freaking out, and they're kind of freaking out. And again, just going back to what you've been saying, is this is something that I don't know, maybe you come out with it the first time.
Yeah, it's really not asking for a lot of information, and it would really reap dividends for public health to build trust. I mean, it'd be one or two extra sentences, in the report, and that's it.
That's it.
And it would build so much trust, so much more trust, and I think they can easily do it in a way that doesn't, violate privacy issues.
Yeah,
I wonder if it's going to be like on the dashboard, public health's dashboard. I didn't see the breakdown, but if the mayors are informed, since they inform them how many are recovered, I wonder if there's an indication that says, retested positive. You know what I mean? So
yeah,
you're going to have to look on there.
To the site. Yeah.
I wanted to ask you about public health's new direction in terms of going out and expanding their testing. Over the weekend, they were at Hemlani Apartments in Harmon, and it is characterized as a possible, vulnerable population, lack of access to health care. Do you agree with this route that they're taking? Because nobody turned up positive from Hemlani.
Yeah, I think it's actually smart to go out target certain areas. I'll say certain facilities or certain types of lodging. There are studies coming out that are looking at areas where there are more clusters or sort of these what they call super spreader events, and so nursing homes is clearly one of those, or a situation like a nursing home. A lot of people living in an enclosed space, so multi-family, or there's a lot of people in an extended family living in one space. Those are areas to target for sure.
Right.
And if they weren't doing this and they were just waiting for the patients to come into the clinics and hospitals, again, we don't know. I don't think they've had. I think they've only had one positive come up from the community testing. There's one from Agate, I think. The rest, I think, have been negative across the board. But even one tells you it's out there in the community, and I think that's useful information for the public to know. That we have not starved the virus out of the community, which I think some people were probably thinking that's what we've done when we have a lot of zeros. And if
you went around this weekend, you saw that it's not just some people. A lot of people are thinking, we're talking recovery already. The zero pod they're just kind of out there, buying barbecue stuff at the store. They're going to the beach. No one is taking it serious.
Well, even though it's still out there, I think that's also to be expected. And this is what we have to live with for months now. It's cases popping up, isolate them, test them, isolate them, trace their contacts, and repeat over and over and over again. And what level of how many pauses are we willing to accept before we elevate the restrictions again? And I think if the past few weeks are an indication, in the past few weeks we've seen us go from a certain state of shelter in place to roadblocks, to taking the roadblocks away, and the numbers have been pretty consistent despite increased testing. So I think that's an indication that probably things, if anything, they might trickle up a little bit. Again, if the past few weeks we got 15 new cases, 15 cases in 3 weeks isn't that bad? And one hospitalization, maybe. Our healthcare system can easily handle that. Maybe we can handle it 2 or 3 times that. People will probably go crazy if they say 3 times that. You start getting 15 patients a week, 2 to 3 patients a day showing positive. Then people really might get a little bit more worried.
Right, but I think what's interesting is in the recovery plan they allow for so many new cases, to have so many new cases and still move forward with the recovery plan and then kind of adjust it in terms. So I'm wondering what the threshold is. I know you kind of dove into that.
I think Dr. Cabrera answered a question about that. He seemed like they were going to take a very rational approach to this. I mean, the way that it's written actually, that says within a 2-week period you've got to show a downward trend. And if you actually look at the metrics that they were talking about right now, it actually shows a slight upward trend. But I hope that they just take a rational approach. I mean, you have zeros and ones and twos on our daily count. You go from 0 to 2, and you're going to have an upward trend, but that doesn't mean that you're in bad shape necessarily. Right. So I hope that they just take a rational approach to their decisions about moving within those PCOR levels. And what the threshold is.
Hey, everybody, we're in PCOR 1. I just throw that out there. I forgot to say that.
What do you think about that 5 cases threshold?
I think that's reasonable. I mean, if it was 5 per day for a week straight, that would be a little challenging, or a little bit worrisome. Okay, my daughter's gonna
Oh,
I'm sorry.
it's okay.
Yeah, no, I think if we were seeing 5 new cases a day for 5 days in a row, that would be a cause for alarm. That would not be normal.
Right.
That would indicate that there's some big cluster or 2 or 3 out there that we need to worry about.
So just based on the information that we are receiving, do you think, and the 4 triggers it appears that we might be meeting, do you think that we're ready to reopen on May 9th? I think that's Saturday.
Yeah,
gradually
reopen. I've alluded to this in my blog. I think we're ready. I mean, I think the triggers, again, if you're just rational about the first trigger with the number of cases that we have, I think we're ready. I mean, but people have to do the right thing in the workplace and out in the public. They have to wear their masks. They have to social distance, and I think it's entirely possible that we don't see a huge change in the number of cases that we're picking up every day.
Okay.
Doc, I wanted to get your 2 cents on I'll just go back to this press conference Thursday because I saw you had posted about it. What was your take on the muting of the media and how that was handled?
Well, I don't know how much they could have predicted that's what would have happened, but I think if you ask the media not to ask a question, that's the surest way to get asked a question, and to be shocked by that happening. I mean, I can see your position. You want to do what's right for the media and censorship, and so you don't have anything to lose by asking the question. You know, it's you either get the answer you want, or they'll shut you down, and then it potentially makes them look bad. So I think from the way it played out, I think probably could have been predicted by them trying to tell you what questions you can and can't ask. So I think it's unfortunate, and if they didn't want to be asked certain questions, they needed to address the issues in advance in some fashion,
Right,
and even then they have to be willing to address those things.
Mm-hmm.
Yeah, and I think to be fair, it was a little more complicated than them telling us not to ask a question. We're like, oh no, we're going to ask it. We go in, we have a plan. We go in, we have our questions, and when they came out and said we're only going to be taking questions about the recovery plan, I mean, we have 2 reporters going in there. So Nestor, of course, is covering the recovery plan, and we just made a call. We're going to stick with the questions we're going to ask. I mean, that's our job. I don't know where the government gets off telling the media what they can and can't ask about. It's just kind of crazy. And then to me, what was even crazier was you were an elected governor. We had a sitting lieutenant governor right there. Who's the boss? Is it Janela Carrera or is it the governor? I mean, the governor could have simply raised her hand and be like, no, Nan, it's okay because the people keep asking.
Yeah.
Instead of just sitting there and there was something like she waved her hand like, God, what is their problem? It was just, all kinds of bad, I don't know who is advising over there, and I don't know if that was all Tony Babauta's call and that's why he's not there anymore, but what they're lacking is someone in the room to be like, hey, mute because I could just see it in my head. I could just see Governor Lou saying, I don't want to go to the press conference because they're just going to ask me about Tony Babauta. And then I don't know who in the room said, oh, don't worry, Governor. We'll just tell them they can't ask about that. Oh, okay. That's problem solved.
Yeah, exactly.
Problem solved.
It'd be so interesting to know how they come to these decisions. And, yeah, the damage control was less than ideal for sure.
Oh, God. The damage control was duck their head in a hole for 4 days.
And they've got a lot more damage control to do moving forward here. They still have a lot of tough questions to answer while they're trying to get information out. And that's, I think the plan was pretty good overall, but that message and the whatever triumphs they could have pulled off in terms of their public relations was just drowned out completely by this other issue.
Right. Way to rain on your own parade.
Yeah.
I wanted to ask about something else though, and this was just in reference to the letter that was signed by the governor and Linda and Pinko Denorsi allegedly. And what are your thoughts on having a hotel as a quarantine and an isolation facility?
And a staff housing. Don't forget a staff housing.
I'm just wondering, because I thought that they had a government isolation facility being Days Inn, but then when I read this letter, it was PacStar was a quarantine/isolation facility. So it sounds like they're having people who are in quarantine with people who have tested positive for COVID.
I guess was that something really early in the course of all this?
Oh no, it's basically based off a letter that was written to Pacific Star from the governor and public health director Linda DeNorsi, and it was basically telling Pacific Star, thank you so much for letting us use your hotel for a quarantine/isolation facility. And then in asking about which staffers are being afforded rooms at the hotel, the info had come out that it was Rebecca Respicio, Alice Tyron, who are, I guess, working the quarantine facility at PacStar, and then the deputy at the airport, John Kanata. And we said, okay, so John Kanata, is he working the quarantine too? And they said, no, we can't respond to why he's there because of HIPAA. And so, I mean, you could kind of put two and two together and figure out what they mean, you know.
And I just wondered your thoughts on mixing quarantine and isolation patients.
Well, I suppose it all depends on how they go about it. I think it probably can be done within the same facility in a way that makes sense. And, you know, maybe they were doing it because they weren't sure that the people on the receiving end had a clear idea what the difference was, and they just wanted to group them together or something like that.
In Saipan, they have one hotel for travelers, inbound travelers, and then another for PUIs and cases. But then Saipan also released how they're spending the CARES Act money, so I don't know.
Yeah, but you know, at Days Inn, at the isolation facility, they have nurses, staff with people. So I'm just wondering if that would be the same over at PacStar. You'd have nurses on standby.
Well, we got Dr. Ho on the line, so maybe he can answer for us and we'll ask him. Hey, thank you, Dr. Lombard. I definitely appreciate your insight.
Okay, Bree, Chris, thank you. Take care.
Of course, yeah. And wash your hands. Are we still washing our hands? Are we still washing our hands? We are, right?
Yes.
Okay. I'm just saying, because, you know. Okay, Doc.
All right, take care, guys.
I dig Dr. Lombard. You know, every time I call him, he's like, why would you want me on? I'm just a little Facebook nerd. Let's get Dr. Hoa, Dr. Wen of the American Medical Center Family Clinics. Dr. Hoa, good morning. Happy Monday.
Good morning.
Good morning, guys. Morning.
Well, you were just walking into the bomb blast this morning, but, you know, I know you never shy away from the fallout.
It's okay. What's up?
So I guess first question, how do we handle the news that there are 6 patients who had recovered now testing positive for COVID-19?
You know, those patients, you know, we learn a lot from this virus every day. And, you know, I mean, we know it happened in Korea, in South Korea, and it happened here. And, you know, I mean, there's 2 possible reasons. Okay, one is that the virus never go away, and they still have an infection there, or the infection go away already, but we pick up just that particle of the virus. And, you know, that's the best choice that we hope, is that we just pick up this that virus particle that the tests pick them up, and not a true recurrent infection. So, you know, I mean, precaution-wise, those patients will be back in quarantine again. 2 weeks
Quarantine or isolation?
Well, isolation, and you know, for another 2 weeks or so, and until they be retested again. You know, but I don't think the literature out there to tell them that, hey, they are infectious as before. But, you know, again, no one knows for sure, because we're still learning on this virus. So there's literature out there somewhere that say different things. So right now, precaution-wise, just isolate them to make sure they don't come in contact with other people, just for possible if they still infectious.
Do we know if they're still at home isolation, or were they brought to the government isolation facility?
That one I don't know. I'm not quite sure. You know, we brought that up to public health about 2-3 weeks ago, because we saw some patients that, 1 or 2 patients of ours that have recurrent positive after they be cleared by public health. So, you know, I think if you can put them in home isolation, it's okay, as long as public health deems that their home is safe for them to stay. And, you know, it's an option for the patient always to go to quarantine if they choose to be, to protect their families.
Wouldn't they have to sanitize their home, disinfect their home? Do you know what I mean? Like, if, I'm sick, I'm recovered, and I'm sick again, Would there have to be a process to disinfect the house?
That's the logic people want, but I'm not quite sure it's be done. Again, okay, it's just, we're not really sure right now. We just basically take the most cautious approach is basically to isolate them. But again, time will tell if these people are still infectious or not. Like I say, the study from Korea showed that it's not infectious. Again, it's just the dead particle that they pick up. So
Okay, so should we be out testing the other 126?
Oh, but my God, that's not a, it's not a real, it's a right or wrong answer. The thought is that we go out and test all this, all these cases possibly before. I don't think so. I don't think we're going to go back and do the test on everybody. Now the real challenge is have a serology test that we can check on future positive that they have an IgM, IgG, just to tell you that the body has an immune system to handle this virus or not. But we don't have a reliable serology test yet approved by the FDA. There's a lot of the countries that have it. It's just that we don't have one approved by the federal government.
You mean through an EUA or?
Yeah.
Or EAU?
But it has
What's this got to do with South Korean test kits, Doc?
It has nothing to do with it. It's just that it's not approved by the FDA yet. We have a lot of test kit out there that on island that we can do, but unfortunately we cannot use it just because it's not approved.
Right. But Doc, I think the obvious question here is, if we are having patients who they're churning out these recoveries, this guy's recovered, and now they're testing positive. Mm-hmm. What would you say to those people who, because of this, have even less faith in the tests and the process that we're using?
It doesn't hurt to do a small study and see if we can, just go ahead and use the serology test. That I know it's not FDA approved, but it's an academic way to test those people, right? But like I say, we as a group of physicians want to start that study, but mind to be say no, so we kind of stuck. Mm-hmm. So we actually that's the study that we want to implement on the public health and UOG study, but someone up there saying no, so we couldn't start a study.
Go back. You said somebody said no?
Yeah, they don't want them to use the South Korean test kits because someone is bothered by it, right? Doc, is that what it is? There's someone at Adelup who does not want anything to do with these South Korean test kits, yes or no?
Yes.
Is it because of politics, Doc? Is that your take on it?
We don't have an answer coming back to us, but I know that physician-wise, 100% of us want to carry through the study. But again, we're not the one to make decision. We can make the recommendation, but someone up there to say no to the whole thing, so everything kind of stands still.
Who's saying no?
Sabrina, I can't tell you that. It's really. Like I say, I'm not quite sure of who. Seriously, I'm not quite sure who say no to that study. I wish I know, and we ask for person say no to come forward. Just because as physician-wise, we want to do the best for the island. I know it's not the FDA-approved kit, but again, it's something that we can use just for the study for our island. Again, it doesn't really hurt anyone to harm anybody just to do the study, because every test we do is backed up by the PCR test, which is an FDA-approved kit. So, that's what the study means, is that you just do it, make comparison, and write things up in order for us to understand this virus a lot more. Mm-hmm. So, it doesn't hurt to do anything, because like I said, it's not a treatment, it's a study. and it's just a blood test. It doesn't just like you do an accurate check for your sugar. It's really, it gives us more information for us to take care of ourselves.
And this is similar to what they did with the Theodore Roosevelt.
Yeah,
where they did the serology testing.
Absolutely,
study.
It doesn't hurt at all to us to do that. We have thousands of kids here on the island that we can use. It doesn't, like I say, what an accurate check to check for your blood sugar, does it hurt on anybody? No, it doesn't hurt. But again, it's the whole panel of physicians say yes, but
the whole panel. You mean the Governor's Physicians Advisory Group?
Yes.
Okay, so the Governor's Physicians Advisory Group says, yes, let's do this study using these South Korean tests, these serology tests, and somebody at Adelup, which you are trying to figure out who, has said no.
Yes. So we have other options. The issue is not dead yet. We might,
I remember the governor said it was a dead issue.
Where are the tests? Who brought in these test kits? You said there were thousands here on Guam.
Yeah, there's a lot of wholesalers that bring the kits in. They knock off it. They have it. They release back to them, but they can't use it. So it's not a dead issue. We will still approach it. We're going to probably fund it privately rather than fund it through the government to try to get this thing to go forward. Because to us, it's just give us.
It's kind of crazy, Doc, that they'll spend $500,000 on 2 weeks of hotel rooms, but they won't spend on these South Korean test kits.
Yeah, but we're going to try to figure out who makes the decision. But I mean, I really, truly, all of it say it doesn't hurt. It's a blood test. It can tell you yes or no, and again, it's backed up by PCR, so it's not like you're going there blindly.
What do you think, though, Doc? You're such a smart. I mean, I look up to you. Is this just about the politics of it? Is it because former Senator Dennis Rodriguez is the one that kind of floated it with the speaker, and they're just like, oh hell no?
Christopher, we really like to stay out of politics.
I know. It's unfortunate.
I mean, this is all about taking care of our people here in Guam, and try to gain a little bit more knowledge ourselves. We read the news, we read the article, read everything else. But like I say, other places they do use it, even if it's not FDA EU approved. But they do use it in emergencies. So in case of emergency, it's not like we're using the kit for diagnosis somebody. It's not. We use this thing as a study to screen to see what the correlates IgM and the PCR.
Basically, it is what the Theodore Roosevelt is doing. The Navy is doing in conjunction with the CDC. Over the past, 2 weeks ago, they conducted these serology tests. They took samples from volunteers, people who volunteered, the sailors. They took all of this and they sent it over to CDC in Atlanta, and it's going to take, till the end of the month to get the results, and it's specifically to study the outbreak. Right? It would be the same situation.
It's the same study. It's a different kit, the same study. It's again, it's a study. It's not a treatment.
A study.
Right.
So,
yeah.
But again, like I say, it's not a that issue. Some private clinic will try to carry this thing forward because we need to know. We just need to know. And like this case, that recurring case, it's beautiful for us. It's just prick the finger. It doesn't hurt. So we can see what do they have the IgM or not, or what happened. So. We don't have to say to the world, hey, this is our study, but this is for locally. We would like to know.
Right. Doc, I got to ask you, because you were in that press conference Thursday, and, you come on the show all the time, and for you to be sitting in that press conference and to kind of be attached with this whole muting of the media, how was that uncomfortable for you? What was your take on that? Because I've just in talking to you, you seem to be very supportive of transparency, and you'd never hesitate to tell us what you believe the people should know. So I was curious how you felt about that.
I'm not backing up anybody. Okay, I just have my opinion is that there's always the right time and the right place to ask questions. Those question that they ask will need to have an answer because you need to be transparent to the public, right? But I used to be in the Air Force. I'm retired 23 years, and there's a right time and right place. Those press conferences at that time is strictly for people to ask for the recovery plan, right? So, there's a lot of questions there the media didn't ask, and the people need to know about the recovery phase. Like I say, those questions are valid. Those two questions are very valid. It's just not the right time, and I'm not quite sure Attitude handled that correctly during that time. I think muting at that time is the wrong thing to do. I think to me, you should just say, those questions are valid. I will answer that question at a later time. But again, it's like I say, there's a right time and right place to ask. Like I
right,
said,
yeah. I respect your opinion, Doc, but if we're not given the opportunity to ask those questions, at any other time other than the press conference, and then it's also, what Adelut wants is they want us to text them questions, because when we text them a question, they text back a response, and nobody's face is on camera, nobody's on the phone to squirm. But the problem with that is if you ask a question and you get a text answer, a lot of times these answers we're getting, they only beg more questions. And so that's why, on our end, that's why we want to ask in a setting like a press conference, because you have a real person there who can give you a real answer sometimes. But then the problem with that is they give us an answer. If we have a problem with it, we've been muted, and we can't say, hey, that wasn't really what I was...
And also the questions that we're asking are on behalf of the people of Guam that are struggling, that are out there waiting in line for food, for food stamps.
I know you get it, Doc. I know you get it.
Yeah.
Those things have to be answered 100%. So that's, like everything we do has to be transparent, has to be accountable for. I'm not quite sure when the right time, right place, but it has to be answered. It's not a text. You can't put your thoughts and your feeling and everything to the public through a text message.
Right.
Social media is good, but when you visualize someone answer a question, you can tell, is that an honest question or it's just a political answer on everything. So to me, transparent, you got to be. That's how the people trust the government. So,
right. And what's crazy is that you see the CNMI, they release their plans on how they are going to spend the $36 million in CARES Act money within the guidelines provided by the U.S. Treasury. And we're still waiting for, where's this $118 million?
If the CNMI is doing it, what's Gov Guam's problem?
Yeah, I think that all the money has to be accountable for and has to be somewhat on the public, say that it goes toward this, and this, so that way you know where it's going. But like I said, those things need to be published somewhere that is accessible and to.
Right.
In your physicians advisory group meetings, do they tell you like, okay, we're going to use $2 million to go to get face masks?
No.
Nothing.
I tell you, the only thing we really ask, we put plan together to approach certain health issue, and we recommend that. But no, we don't talk about money during the advisory board.
Right.
What about this? This whole letter that we saw with the governor's signature and Linda DeNorcy's signature regarding the PacStar as being used as a quarantine/isolation facility. Is that? Would you agree that a quarantine individual should be with isolation individuals mixed together?
No. We have quarantine hotel and we have isolation hotel.
So when it says PacStar is quarantine/isolation facility, is that? That's what it says in black and white. Quarantine/isolation facility.
That's why we have days in and the other hotel.
Yeah, and that's what I had thought, that they had the isolation facility, which was days in, and then you had the PacStar, and I'm not even sure what other hotels are being used as quarantine facilities, although if it's our money being used for these facilities, we should know. But in the letter that I saw, it said PacStar quarantine/isolation facility. And you're saying that it should not be, these different sorts of groups should not be mingled together.
No, they clearly have to be, separate, and that's why we have multiple. That's what we were briefed. That's what we recommended. So they should not be mixed together. Those only for people that are flying in to be, on quarantine.
I understand that.
Yeah, and
It's for people flying in, and also the chief of staff when he needs somewhere to put his head on his pillow.
I'm not quite sure that's the right answer. Like I say, it's a quarantine hotel, and there should not be a mix, and that's why whenever you turn positive, they pull you out and place you at a different hotel. But not to stay there. The thing is, I know room is separately, but there's always, there's a risk of have a person that's positive, expose someone else. So that's why there's two, separate hotels,
right?
For two different populations.
Right. Yeah. And that's what we at least that's what I thought. I didn't know that it was a quarantine/isolation facility over at the PacStar.
Doc, if you just look at the military, they're keeping the positive cases on the base and the negative ones at the hotel. So even they seem to be separating these two groups.
Even if you turn positive in a hotel, they pull you out.
Right.
This is the letter. It was dated March 18th. Dear Mr. Pothin, thank you for allowing the use of your property as a quarantine isolation facility. Pursuant to our agreement, the PacStar Resort and Spa is hereby directed to be used as a non-congregate shelter pursuant to the powers afforded by the Organic Act of Guam and Chapter 19, Title 10 of the Guam Code annotated. Sinceramente, Lourdes Leon Guerrero and Linda and Bingo Denorsi. So does that sound like it's being used as a quarantine and isolation facility?
Yeah, it sounds like it. It should not be mixed, and public health know that. So,
Well, there's a report that came out that Linda Denorsi didn't even sign this thing, that they used a digital replica of her signature. I've been trying to get a hold of her all morning. I started my morning by sending a message to the policy director, Carlo Branch, and also the new acting chief of staff, John Jr. Calvo, saying, hey, what's up with these reports of Linda saying that she didn't even know you guys used her signature? So I think this just calls into question the whole deal, where you have the governor's legal counsel, who also happens to be her son-in-law, running around town calling shots with little to no checks and balances. You have the AG's office, and this is a subject we're going to get on with Senator Sabina Paris, Doc.
Yeah, that's the transparency that we have to go through. But like I say, those things need to be really right in the middle. Either quarantine or isolation. But to me, even when you're in quarantine, you can see some people turn positive, and as I know that when you're positive, they transfer to another hotel, but not to be staying there. You should not be staying in a hotel that is nice and clean. That's what we term as a clean hotel and a dirty hotel. So. Just like GMH and GRMC, you had a clean hospital and you had a dirty hospital, and that term is just choose because to make sure that there's no chance or to minimize the chance of transmitting the virus to someone else.
Right. It's kind of basic, Doc. It seems pretty basic.
I know.
You don't put the sick with the people who aren't sick.
Yes, and once you go into a hotel for quarantine, you stay there for 2 weeks. You don't go in and out. So that's the part where I don't have the answer, but you have to accountable for and answer to the reason why they stay there. Even for the healthcare worker, if we, our option is that I can stay there on the quarantine hotel if I deem that I'm in danger to our family, right? If you have an elderly family at home and you work around COVID patients all day, they have an option to stay at the hotel during the duration of their exposure to make sure they don't give the virus back to their family.
Right, and that's another facility. I believe that's the Perlis Court.
Yes, that's but we don't stay at the Pacific Star.
But I think it's interesting that any regular Joe cruise lands on a flight into Guam, they got to go stay in quarantine for 14 days, but the former chief of staff can spend the night wake up the next morning, oh, I feel great. Hey, assess me. You're good to go, Chief. It's just clearly, it just shows that the whole system of, the integrity of this system where we're...
whether or not
all
that's
out the
even
door.
going to be reimbursed by FEMA.
I mean, it's a hotel room. It's kind of,
and they got to make sure that they are documenting every single thing that's happening.
Doc, we're going to let you go because we're getting out of your. This kind of seems like it's above your pay grade.
Yeah. Well, real quickly before we do let you go, we're back to the study. You said that there were a wholesale company brought them in. How many test kits and what clinics are you looking at to implement this study?
We have over like 1,000 of test kits. I can't know the right number, but what we do is that we give 50% of the test kits for public health to do their tests. Okay, and the other 50% we divide among like 5-6 other different clinics, and we're going to target some of the population there and test them at random. And also target testing and ask for their permission. We always ask. It's not someone that walk in and say, we're going to do a test, and we're going to ask, we're going to inform them it's a study. If the patient say yes, then we carry forward. So it's not a bad issue. Some private clinics, most likely, I can tell you AMC will be one of them, and to do the study, but we need to know. And we will privately use our money to do it. It's just basically, like I say, it doesn't hurt anyone. It just gives a physician-wise in the community to know, hey, what's the prevalence of the infection out there?
Right.
So just like those 6 cases that turned positive, it's nice to know more information about them.
Right. It would be, yeah.
Okay. And how soon do you think you might be able to do this? Or are you looking at?
We would talk to other private clinics, and we come up with a fund. And we would carry out the study. I mean, we can do that. So we will come up with our own funds to do that.
May 9th, is that still the target date to move into PCOR 2?
Not if you guys keep testing positive.
Yeah, we can test positive, but again, it's a percentage of tests that positive that we look for. You can have 2 positive, but doesn't mean that we can move to the next peak.
Right. Yeah.
Because remember, percentage-wise, we have to say less than 5%. So, still good. The hospital, the criteria for the hospitalization, we still have 0 hospitalization at this point, so we can handle any surge. But like I said, we expect a second surge, like other places in the world does. But again, Guam is sometimes unique. And depend on people, social distance, everything here, and the density of our population, we might not have the second surge, but we have to kind of prepare as the other place has the second surge.
But again, you're still looking at May 9th to move into PCOR.
We got to get Dr. Cabrera and find out, how many positive cases would it take to derail this whole, gradual reopening of May?
I tell you, it's less than 5% or of the tests that we do. Right now, that if you do 72 tests or whatever, 2%. So it's kind of small. So, again, it's not the number of positives we see, it's a percentage of the tests we run that turn positive. Including the other 3 criteria that they use there. Okay?
The ability to contact tracing.
The virus is still out there. Okay, bottom line. It's never going to go away. It's going to go toward the flu season in September. That's all we're going to pray about. It's going to get confused in the flu and the virus, the coronavirus. So it's going to go. It's still here. We just really need to open up, but we need to open up in a way that the people understand that social distance and mask is mandatory. It's a new norm for now. Okay.
Okay.
Okay, Doc.
Thank you so much for your time.
Thank you so much for your time, Doc. I really appreciate it.
When you find out who's blocking this at Adelie,
let us know. You don't have to call. Just shoot me a text. Okay. Now they're not going to tell him anything. They'll be like, "Hey, you heard that on containing COVID? Yeah, don't tell Hoa anything."
Okay. Thank you.
Okay. Goodbye.
Care.
Wash your hands. Hey, our buddy Dr. Hoa. Let's keep it going here. We want to talk transparency. Bree, did you kind of want to go over this whole hotel quarantine thing, or let's bring on Senator Sabina Perez, who is your legislative oversight on procurement. And thank you so much, Senator, for taking our call this morning. I really appreciate it. I know I got you up early, so thank you.
Good morning.
Good morning.
First of all, I just want to maybe confirm something with you. I had heard that was there some type of meeting with the governor's legal counsel and the sitting senators regarding this emergency procurement of hotel quarantine facilities. What can you tell us about that?
So we did have a discussion on transparency and other things that should probably reveal today. What I can tell you is that there were issues. I don't know the depth. I kind of heard a little bit when I got on the call this morning that what you FOIA'd. I don't have all the details of the contract itself.
Well, I don't think there is a contract, first of all, Senator.
Okay. Well, there was a FOIA that was done by KUM, I believe, so I don't have all the information that you guys received.
Right.
So my understanding was that there was some suspension of procurement practices, so that is that is something that I would have to look into and see what the details are. Right. I believe they are coming out with a statement regarding some of the issues that came out of procurement. But having said that, the emergency procurement is pretty clear, is that it does allow for purchasing of emergency services and goods, and it doesn't have to be the lowest. There is a rule, 5010, that allows for trade-offs for quick delivery over to a certain extent. So basically, generally speaking, you have your 3 quotes. You go for the lowest bid, or there is some trade-offs if you can get it quicker. So that's emergency procurement, and it's only for 30 days. And so, understandably, this virus is pandemic is a longer process, and so I can understand that some of the procurement law does not apply, but I do want to say that they have a lot of professionals on their team, and I think now is the time to really tap into their professionals and not to avoid procurement law. That is something that and the fact is too is that they did impanel the policy office, procurement policy office, that is, to come up with guidelines to improve procurement law. And they were supposed to come out with a finalized formal report within 7 months, and that was back in 2019 in October. I did reach out to the policy office, and they did not have anything formal to release.
Out of loop policy office, Senator?
Yes. This is not to be confused with the policy office. There's a procurement policy office.
Right.
And there's another policy office.
Okay.
So I'm talking about the procurement policy office.
Okay.
And that is headed by Edward Byrne. And so that's something, really now is the time. And I think part of the issue, too, is this pandemic has really highlighted some of our deficiencies in government. And one of it is really just we need to shore up this procurement process.
Right. I guess, Senator, let's just go back to the beginning. So, and kind of gleaning all the information that we've reported on, that other media has reported on, it appears that, first there's an issue with Linda DeNorsi saying that she didn't even know her digital signature was used on some of these documents. So there's that, right? And then there's also that we entered into these deals with these hotels without a contract. And then there is also that the, governor's legal counsel is asking for, expedited payment for these guys without, the only thing I saw in writing was a letter from Pacific Star saying, hey, you owe us over $500,000 for 2 weeks worth of rooms.
Wow.
And so I just want to say you are supposed to be the watchdog of procurement at the Guam legislature. So in getting the information that you've been able to glean, I know you said you haven't got the FOIAs yet or whatever, but does this pass the smell test to you?
Definitely not. That's fraud. Using somebody's signature, that is definitely an issue of fraud, and that doesn't pass. For sure.
Who was in this meeting? Was it a Zoom? Who all participated? Who was leading this meeting?
So it was called together. Let me see. I need to get this correct. But what I could say is that, senators and the governor with her staff.
The governor?
Governor with her, the policy office.
Okay, so do you have some names? Is Governor Lilian Guerrero and who else? Policy people?
The policy.
The
Department of Administration Director Edward Byrne, BBMR Director.
No. It was Carlo Branch, High Legal Counsel High, and John Jr.
Okay, so senators. How many senators? All of them?
I think there were the Democrat senators.
Okay. All the Democrat senators. Okay, so all the Democrat senators, Governor Lilian Guerrero, Haig Hyun, the governor's son-in-law / legal counsel, Carlo Branch, the chief policy advisor?
Yes.
So what was the gist of this meeting, Senator, if you will, if you can?
Who called the meeting?
So it's not clear if it was either the speaker or the governor's office that reached out, but I believe it's something they were gonna share. I don't want to. They're going to reveal a plan, so I don't want to give that information out. It's going to come out in the press conference.
Okay, so but what can you tell us? Was there anything specifically addressing the quote-unquote procurement of these hotels as quarantine and isolation facilities? What can I say about that at this point?
Yes.
Yeah.
You can tell the truth. I mean.
Yeah. What I could say is that procurement it doesn't follow procurement policy.
I'm just curious why you're saying what you can say. Are you being
Are you guys scared of the governor's legal counsel or something?
You're not allowed?
Not at all.
Because it kind of seems like he throws his weight around. If you look at these letters, it kind of seems like no one questions his decisions. It kind of seems like he unilaterally decides so many things that are happening in this, as far as like at least procurement. That's just what we know about him. We don't know what else he's leading the charge on, but it does kind of seem like in reading these emails that his tone indicates that no one is going to challenge him. He's like, hey, we need to pay these people out as a cash flow. We need to worry about their cash flow issue, so let's pay them. I mean, nobody was like, is there an invoice? Or, I don't know. So we're just asking you as the legislative procurement chair.
Yeah, the problem is the specifications changed. So I mean, they were trying to get services. Then it's I think with a lot of So basically, specs changed, and that to me, that's what I heard in the conversation, is that specifications changed as they were trying to procure rooms, and that's an issue when it comes to solicitation. Right. That you have to stick to the specifications.
So when they went and they procured these hotels, were they supposed to issue out an RP or anything? Everything they did up to this point was above board.
So the only thing that I heard was that the specs changed, and so with the emergency procurement, you have to. It's a request for quotes. So basically, you have to at least get 3 quotations, and you base on the lowest cost or delivery time. So that's the process.
Right, but I think
it's much more streamlined. Instead of having bids submitted and then evaluated, you can call around for the quotes.
Mm-hmm. Senator, there was something I saw a couple weeks ago where the Adelup press secretary, Crystal Pago San Augustine, had said that I believe Pacific Star was one of the only ones that had answered the call. So I'm wondering, how are they going to get 3 quotes if they already said that hotel was the only one that answered that specific call for a quarantine isolation facility?
In the conversation, they did reach out to all the hotels, and they got a limited response. I don't know if it was just one response, but that was the process they went through. So they did go with the 3 quotes. They did look around.
I see.
Was that in writing, or that was
because it kind of seems like there's nothing.
Is there a paper trail?
So that wasn't brought up in the conversation, but just the fact that they did.
I'm sorry, that was not? Did you say that was not?
I didn't get that information from the conversation.
Hey, I want to give you credit, though, Senator, because, I mean, you guys have been out of the loop over there at the legislature. Adelup, we just overwhelmingly and unanimously passed a bill calling for more transparency from the governor's office, and this is exactly why we passed that bill. And anticipating the override from what we talked about with all with the senators that we touched base with last week, and this is exactly why. It's because you guys, it's like worse than pulling teeth to get answers.
Did they call this meeting, or you guys had this meeting yesterday to discuss, to be transparent, or because they wanted to unveil a plan?
It was twofold. So both of those. Yeah.
So did it appear like it's an attempt to make sure that you guys don't override Bill 333?
I don't think that was the reason. I felt there was. Yeah, it was twofold, to really kind of reconnect to. I'm not too sure. I didn't get.
When's the last time you guys spoke with the governor? Like that, via Zoom or however it is that you guys spoke with her?
Yeah, I don't recall the time, but we it was before the pandemic.
Right. I wanted to read this comment that we just got from the Attorney General's office. I had asked, can we get the AG on the hotel quarantine procurement? Does he still oversee GovGuam contracts? Because they're only open an hour a day, so I don't know how much time that gives them to actually do their jobs. But AG spokeswoman Carlina Charfris writes, Buenas, we cannot comment on ongoing procurement, but our office's role is to review contracts for legal compliance, including laws that are triggered when a public health emergency is declared, and we will continue to fulfill this duty. I just want to go back to the term ongoing procurement. Is this procurement still ongoing if they've already been paid for services that they've provided?
We don't know if they've been paid.
Well, I don't know. It said they got an invoice. Yeah, you're right. Is it? Do you think this is still something ongoing? I mean, I feel like the Attorney General should be coming down maybe a little bit harder on this.
Well, if the services are being provided, the assumption is that there isn't a procurement that's occurring. So I don't have the details in front of me to really.
All right, but based on the meetings you had yesterday, you're satisfied with what was presented to you, and senators are satisfied with the way this whole hotel issues have gone down.
No, there was missing information, so I wouldn't say satisfied.
Okay, so it's Packstar and what other hotels?
I don't have the details on that either.
So you're kind of just getting it at the same time we're getting it. That's why, we woke you up early to throw all this stuff at you, so I do want to give you credit that, you're saying right off the bat, this does not pass the smell test. And so I think that's something that,
is that what
that's
you're
pretty
saying?
Big. The using of digital signatures, that's fraud. And just the fact that they are, did not follow procurement standards.
Right.
I think, that's definitely not.
Right. And we had a comment in here, and this is something I've heard from, this guy's actually a lawyer, Stephen Attori. Every typhoon we use emergency procurement. It's not a novel concept. But Senator, what I want to ask you is, if you're familiar, I'm assuming as the oversight chair on procurement, is the type of emergency procurement and the process that we use after typhoons, is it matching up with what we're doing right now? Because I've been told that it's not, that what we're doing right now to procure these hotels is not normal in any sense of the word. That, I've talked to a few different lawyers and they say, no, you don't do it that way. What's your thought on that?
So I don't have the luxury of comparing the past. I'm just kind of working on what's in front of me right now. But just judging from what you're telling me, it doesn't look right. So I don't have the luxury of actually comparing with the past.
But I know you're going to get.
But does the law
just
say when there's a pandemic, it's a different set of rules for emergency procurement as opposed to when there's a typhoon, or is emergency procurement emergency procurement?
Yeah, there. To me, there. So this is interesting. Yeah, the part where the practices should remain the same, regardless if it's health versus typhoon.
Mm-hmm.
Yeah, emergency procurement should be the same.
Right.
Okay. And so based on that, what was supposed to be done?
Just walk us back to the beginning.
Yeah.
In a perfect world, Senator,
there's an emergency. A state of emergency is declared.
Right.
So everything should be in record, and there should be three requests for quotes that should be on record. I think the problem might be the changing of specifications as things were changing. There's basically they should have had staff that were procurement experts to help them guide them along the way, and to me it's clear that they didn't utilize the expertise that they have on board.
It kind of seems like it's a one-man show. The governor's son-in-law / legal counsel just throwing his weight around town.
So when
I can't say
when all of this was being disclosed during this meeting, this conference you had with the governor, with Haig, her son-in-law, the attorney, who BBM? Did you say BBMR?
No, it's the procurement. policy
Carlo Branch. So when you guys had this meeting yesterday, was this
was it Carlo
concerns?
or was it Mr. Byrne?
No, I'm sorry. It's Carlo Branch.
Okay.
Policy office, not the
Got you.
policy office.
Okay. So when this was brought, when they were discussing this and disclosing this, telling you how they went about procuring, did anybody raise their hand and say, "Oh, red flag, this is wrong"?
Well,
or was it like, okay, thanks?
Well, I did weigh in on the issue, and so the only information that I got was that the only information that I gleaned from the conversation was that the specifications changed through the process. So I wasn't aware of the other aspects of it, and so that's what I brought up is that is an issue because it changes the scope of work, and when you have procurement, when you're practicing procurement, you have to ensure fairness to all bidders, potential bidders, and that was the issue that I picked up from the conversation. So regarding the other issues, I'm not aware of those other issues until this conversation.
So Senator,
any other procurement? I'm sorry, any other aside from the hotels, like medical supplies, equipment, PPE, anything else that kind of raised a red flag for you?
We did not discuss any of the other things. It was, there was just that only part came up in the conversation, but nothing. It wasn't a global discussion.
Right. So what are you going to do?
Not even test kits?
What are you going to do about it, Senator? Are you going to? I'm just thinking like we need to call an oversight hearing. We need to call an oversight hearing. We need to get the governor's son-in-law, legal counsel, Lester Carlson, Carlo, all these guys in front of the legislature to answer questions. I just think that's a no-brainer. It's a no-brainer. So is that something that you're going to be doing? Or are we going to continue to take Adeloop's word for it that they're going to be transparent?
Yes, I can call an oversight on the procurement aspect.
Well, okay. What about tax refunds? Everybody's been asking about that. You are the oversight chair. And also stimulus checks. Yeah. I'm sure there's probably one senator in the room at least that said, "What's up? When are we going to get this?"
Yeah, so we do have an SES meeting coming up, and that all the questions are going to be asked regarding that. What I understand is that it's holding up the stimulus checks. So just to be clear, the stimulus checks is different from the unemployment aspect, which is different from the Corona AIDS, which is what came in. The $111 million is what came in, but the stimulus checks have not come in. It's pending the approval of the implementation.
Right. Okay, we know that. So what about the $118 million? Did they provide you guys a breakdown? This is what we're going to use it for. We're going to give $500 to people. Do they tell you guys anything? Because the CNMI, they're already saying this is what we're going to use our $36 million.
It's kind of bad when you're holding up the CNMI as an example of transparency. That's all I'm saying. It's like, they got their own things going on, but when they're beating us in transparency, I would just be embarrassed as the governor of Guam. I would be just so ashamed that here's our people here on Guam every single day. I need my wand.
Did anybody in the administration tell you guys yesterday what they're going to use the $118 million for? Because the people of Guam have a right to know.
Yes, the budget is coming out. They're working on the budget, and they'll be releasing that this week, I believe.
The Gov Guam budget?
The budget for the 100.
I see. Okay, gotcha.
The $118 million? Is that
100? The 100 Corona virus.
Mm-hmm. Right. Are you saying 111 because they're using $7 million for quarantine?
Sorry, I'm not getting the numbers correct. Yeah, the coronavirus funds that came in, they're going to they're creating a budget for that, so they're going to report that out
during today's press conference, or
I'm not too sure about today's press conference, but they're working on the budget.
So, Senator, I just want to go back.
But did they give you guys a preview of the budget yesterday?
No.
The breakdown.
No,
so you have no idea what they're going to spend this $111 million on?
No.
None of you guys, right?
No.
You should know, right? I mean, is that a stupid question? Don't you feel like you guys should?
That's something we've been asking for.
I know, yeah. And so, how does this kind of how does this play into this potential override of Senator Theresa Lahi's transparency bill? Because again, this is exactly what we're talking about. This is exactly why you guys felt like you needed to unanimously pass a bill like this.
I think it still can be done. I mean, it's better to have it consistent, some sort of consistency. It doesn't diffuse to me the issue of whether we override it or not. I think it's a good measure.
Yeah, and I
Do
know
you
you're
support an override? Will
of course,
you vote?
she's a second co-sponsor.
I'm just asking. I mean, they had a conversation yesterday.
Right. Yeah.
Yeah, I think it only helps. It would only help the situation.
Right. I don't know what senator will be dumb enough to come down and be like, no, they're going to be transparent, guys. We don't need to override this. We're cool. They mean it this time for real. They pinky promised. I mean, right, Senator, but we got to run because I want to get Father Paul on here. But just again, in closing, you had made a commitment here that you're going to do an oversight hearing on this procurement. Can you just be a little more specific and then tell the people out here, because people got questions, obviously, exactly what is the procurement oversight chair of the legislature going to do about this hotel procurement, which, to a lot of people doesn't pass the smell test?
Yes, I can call an oversight on the procurement for the hotel and other issues, and using this too as a way to ensure that we shore up procurement practices. This is something that we really need to give attention to. If you look at the GSA, they're understaffed, and I think it's really high time that we make this a priority in our government. It's something that I've always promoted and advocated for. And I think just because we're in an emergency situation doesn't mean that we skirt or try to get around procurement laws. It's important that we ensure fairness for all businesses that want to avail themselves of any contract. So I think it's important that we ensure government practices,
right?
Procurement practices.
Okay. Well, thank you so much, Senator.
Thank you.
Thank you for your time, and wash your hands.
Likewise.
Okay. Thank you, Senator. There you go, Senator Sabina Paris. And you're very frustrating for our elected senators because, for the most part, they're finding out information in the press conferences. They're finding out information when the media finds out about it. But again, when they get this information, I think it's refreshing that Senator Sabina is being hit with all this info, a lot of it which is new to her, and she's still saying we're going to call an oversight. There's just too much hanky-panky going on here. And thank you for that. 7:48. We'll take a little break here. It's KUAM News Takeover, Guam's favorite, containing COVID. Good morning.
Join us.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
In order to win this war against COVID-19, it's going to take all of us to do our part.
We are all frontliners in this epic battle.
And on Tuesday, May 5th, we're asking you to answer the call to help by taking part in Giving Tuesday Now.
It's part of a global initiative to set aside this one day for the pandemic crisis.
To step up and give a donation to any of our island's nonprofit organizations,
the hospital, the Mayor's Council of Guam, or any of our frontline workers.
Whether it's PPEs, gloves, masks, canned goods, no donation is too small. Anything and everything will help.
And if you make your donation, take a picture, post it on social media, and use the hashtag GivingTuesdayNow and GivingTuesdayGuam.
And then later that night, make sure to tune in for our half-hour special Giving Tuesday Guam, Together We Give. We'll showcase how everyone is taking part.
Be healthy. Be informed with ITD. Middle school, high school, and college grad photos will all be accepted. Head of the class of 2020, will also be featured weekly on KUAMU's digital platforms. Let's celebrate the class of 2020 together.
Good morning, Guam.
Half a day.
Hey, on schedule, Lieutenant Governor Josh Tenorio calling in a little bit after 8 o'clock on containing COVID. We'll definitely had some questions for LT. I'd also reached out to the new acting chief of staff, John Jr. Calvo, to get a call into the show this morning. Unfortunately, I'm pretty sure he's in a ton of meetings. Maybe he's right now. He's in that don't mute the media meeting.
Hey.
Okay. So we got a commitment from him to call in tomorrow. It's for all intents and purposes, it's his first day on the job. Let's go to the phones now. We have Father Paul Guffigan standing by. Father Paul, good morning.
Good morning, Chris. Good morning, Sabrina.
Good morning. Some interesting news. Actually, the Archbishop on Sunday during the Mass announcing that they're going to have the parking lot services.
Well, the government's office reached out to us last Friday and basically saw the same things we were seeing as far as what is essential for our faithful. And so the bishop on Saturday morning during the reconsecration after the Mass announced that we are going to proceed, with caution, and he used the word prudence, which is very, very important for our faithful to receive the sacraments, but with caution and prudence, especially on the priest side, on the minister side. This morning, the liturgical commission is meeting to finalize our protocols on how to proceed with baptisms, how to proceed with confessions, weddings, of course, burials. We already have a protocol for that, and then, of course, the Mass, which is the most important.
Right. So
we'll be finalizing that this morning and hopefully rolling it out so that all the priests are on board. And again, this is really for those parishes where it's feasible. Number one, feasible for the priests to actually celebrate Mass in an open space or a parking lot, because some parishes don't have an open space. For example, Tumon, Blessed Diego, there is really no open space there. They only have places for people to park, but that's behind the church. So it's really for the pastors we're giving them the opportunity to decide if they would like to take advantage of this, because we're still under executive order, and again, to proceed with a lot of caution and a lot of prudence. So if it's not feasible for you, and some pastors might not want to celebrate Mass, because we definitely advise those pastors with the pre-morbidity conditions, like diabetes, or those are pastors who are elderly. Probably it's be up to them to decide if they would like to minister the sacraments.
Well, it sounds like there was a change of in position, because I thought initially Public Health denied the original request. And so what was the difference? Am I wrong? What's the difference?
No, I mean,
I thought it was here's what we plan to do, shut down. No.
You're the best,
And then now
Sabrina.
you're saying Friday you got a phone call and said, okay, you know what? We prayed on it. Let's do it. Is that pretty much what we're talking about here?
Let's be kind. Let's be charitable towards.
I'm not being. I'm just. Isn't that what happened?
I think for in the position that she's in, Linda DeNorsi has a lot. She has to answer questions from a public health perspective, and although I was surprised, because Linda DeNorsi is a very, 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 very lively and practicing Catholic. But on the other hand, I'm not really surprised either, because she is the public health director, and probably it is within her position to say what she had to say.
Right.
And what we were waiting for mostly was a response from the governor, and that's really what we were waiting for. And it wasn't exactly asking permission to celebrate the sacraments. We were sending them our recommendations and what we were planning to do as church, to make sure that our people, that our faithful, receive what is essential, and that is the sacrament, and most especially the Mass.
Right.
Well, I don't think Linda wouldn't make a decision without the governor giving her the green light.
Yeah.
So when you got the big fat no, I don't think it was without input from the front.
I was off. Sorry, Father. I was off on the side pressing buttons, but did we already cover, was there any interaction that you guys had with Adeloop in any way, shape, or form over the last 3 days?
You said Friday.
Friday? Yeah.
Okay. Friday morning.
Friday. Well, who was was it with the governor, or was it Haig or Carlo?
It was with the governor's representative.
Who's the governor's representative?
Well, he's now the acting chief of staff.
John Carlo.
Okay. Yeah,
right,
okay.
Yeah. Now, he's a hardcore Catholic too, right?
Yeah,
so
he is.
Did you kind of lean into him and be like, John,
What's up with
We're
that,
we're
John?
talking about eternal salvation here, John.
No, John was the one that reached out to us.
Okay.
That was good.
So you guys
So
got
we're very thankful.
the green light to start having the different sacraments and
Yeah.
the outdoor masses, and then what? You have to meet and finalize protocols and then send it back to Adelup?
No.
No, you guys are good.
You're good.
We're going forward with this.
Okay.
Father, you had a parking lot mass yesterday, right? Am I correct on that?
I was told by some people that they're going to be there, rain or shine, so I was prepared. I still had my Facebook mass, but when
Your
I looked
Facebook
outside
mass?
the window, yeah, we have mass on Facebook, and one person came in and plugged in his speakers on his truck, and full blasted the mass on Facebook in the parking lot.
You rebel priest, you. Oh, my goodness. You rebel priest. May the fourth be with you.
It was still safe. I mean,
We're going to need a blessing after this.
So, Father, did people receive communion yesterday? And can you tell us how did that go?
yes, people received communion. I put on my gloves. I put on my mask, and people were very, very, cautious, and they followed protocols. They had their social distancing, very orderly. There was no chaos. I think when we do have this in the future, there has to be some kind of traffic director out there to direct the traffic, because there are only so many cars that we can fit in a parking lot.
Right.
Yeah.
And the other thing that we have to think about also are, practical things like, are we going to have mass at 10 o'clock when the sun is really hot? Is it feasible to have a mass at that time, or do we just want to have mass in the early morning and maybe 2 masses in the evening, something like that, so that the people are not going to have sunstroke, in the parking lot. So there are a lot of things to think about also.
Right.
So will you guys be posting the protocols, I guess, or even just give it to us and we could post it once you guys finalize it?
Sure.
Yeah.
I will.
Okay, yeah. And, hey, I just want to give you guys a big, really, this is so awesome, Father, to see the reception. And we've got like less than a minute, but just real quick, your thoughts on Santa Maria Comelin. That was just, amazing. It was awesome.
That is what we all needed. All of us needed that for Santa Maria to go, take her down from her niche in the cathedral and to bring her out to the people, because we need our mother to visit us. Especially in times of pain and, in times of illness, our mother came to visit us. That's a beautiful gesture. And people really felt that.
Amen. Amen. To that, Father Paul. Needs a tough and stroll, Santa Maria Comelin. Let's go, girl. Hop in. We're going to take you out.
Pray for us. Pray for us.
That's what we
Take her on a road trip.
right. The gas is low, doll. Let's go.
No.
All right. Well, I just wanted to provide a little lightness here, Father.
Thank you.
And if you could add us in your prayers a little extra today, because we got a press conference to go to. We don't know how it's going to turn out.
I'm always praying for you guys.
Thank you. Thank you, Father.
You're doing a wonderful job.
Thank you. God bless you.
Take care.
God bless you, too.
Wash your hands and keep us posted.
Will do.
Okay.
Bye now.
Bye.
All right, 8:02. Some good news. 80, yeah, so we're going to take a break here. We're going to flick the shows up on KUAM TV 11. We're going to come back and do our open, do some news, and then Lieutenant Governor Josh Tenorio coming on to the KUAM News Takeover of Guam's favorite. It is Containing COVID, KUAM FM, Hagatnya, Guam. Good morning.
Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus, gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD.
In order to win this war against COVID-19, it's going to take all of us to do our part.
We are all frontliners in this epic battle.
And on Tuesday, May 5th, we're asking you to answer the call to help by taking part in Giving Tuesday Now.
It's part of a global initiative to set aside this one day for the pandemic crisis.
To step up and give a donation to any of our island's nonprofit organizations.
The hospital, the Mayor's Council of Guam, or any of our frontline workers.
Whether it's PPEs, gloves, masks, canned goods, no donation is too small. Anything and everything will help.
And if you make your donation, take a picture, post it on social media, and use the hashtag GivingTuesdayNow and GivingTuesdayGuam.
And then later that night, make sure to tune in for our half-hour special Giving Tuesday Guam, Together We Give. We'll showcase how everyone is taking part.
This is a compilation of words written down on the board of my dreams. This is a complicated line with too much rhyme and sound, it seems. But you seem to love when I sing. The troubles do sing to love when love when I sing, the troubles do sing it.
Oh yeah.
I got to be so afraid.
Good morning, Guam. It's 8:09. Hey, there's so many ways to catch this show containing COVID. Of course, right here on the radio where it all began. It is so great to be back on Guam's favorite 994, 93.9 FM, KUAM FM, Agotni, Guam. Also, we're streaming on KUAM.com and on the KUAM News app. There's an audio stream, Docomo Channel 10. And good morning, Manana Sidus. Going out to our KUAM TV 11 viewers who are catching the last half of the show. And last but not least, to our amazing and awesome KUAM News Facebook Live audience. Keep the comments coming. We see them. There's a ton of comments. Mm-hmm. And that's why we ask you. I mean, just the comments alone. I mean, that's get your popcorn and your Tabasco. Okay, and share the show. If you guys want to, when the show's over, real time, you check out a lot of the comments that we had when we had Senator Sabina Perez on. But 8:10 now, and let's get Lieutenant Governor Josh Tenorio onto the show. Good morning, Lieutenant Governor.
Good morning.
Good morning, Chris. Good morning, Sabrina.
I guess just first of all, let's start at the beginning and go back to Thursday, that press conference in which the media was muted. And we're just going to dive right into it, LT, because we know that your time's very limited.
No, that's fine. I think it was wrong. I mean, I was a little startled, and if the communications team did not apologize, they should. I would apologize. I apologize, and I think that was a really bad mistake, and should not ever happen again. And I saw the letter on transparency that KOM signed, and I fully understand and support it.
So when you say the communications team, are we talking specifically about the communications director, Janela Carrera? Because we're just trying to figure out, whose call was that?
It should be well, first of all, since I'm, I'm part of the administration, I'll say publicly I will apologize, but I think that Carlo Branch and Janela, absolutely, they should apologize for it. And I guess I'll find out later today and make sure that they do.
Wow, so are we going to get a press conference and open? You guys are going to put Carlo out there and Janela and have them apologize? That'd be something else.
Well, I think they should definitely call you guys or talk to the media and do it. That's what I would expect them to do, and right. I would like to ask them to do.
At least person to person, right? If anything.
Yeah, absolutely. I mean, we're all going to be living in this island for the next few years, and we shouldn't be so disruptive or to change the method that we communicate with each other.
Right.
Just because there's priorities in messaging you want, that's one thing. But we just have to. We're public officials, and we have to face the questions. And even if the answers and either we don't know them or they're not the best for us, we just have to do it.
Mm-hmm. Pretty basic common sense there, LT. Thanks for that. I guess you want to go right into this PacStar, because we do have some questions about this Lieutenant Governor. So I guess you just want to start at the beginning. My first question would be, is the way that this procurement, if you will, was handled, and it's weird because I feel like the procurement has been handled. I mean, we're using these facilities, but the Attorney General's office is saying that it's still ongoing. So does what the Governor's legal counsel and son-in-law, Hai Hun, does what he has done to procure these facilities, is it going to hold up when the feds start looking over everything with a magnifying glass?
Well, I think that right now, and part of it is I'm learning also the details, looking at the FOIA and the news side. I think that there is some concerns, obviously, and the AG and the Chief Procurement Officer have to come in, and the internal controls of the government have to come in and, I guess, be applied to the situation. I think there is an emergency. Obviously, people are coming in, but, there's still, as the emails point out, there's still a standard, and I think that that is going to be reviewed, I would think, and there has to be a standard enforced. Mm-hmm. Whether or not it meets the standard yet, I don't know. I wasn't involved in the procurement, but I would expect that, we have some good minds
and they need to always make the best advice and make the best decision on these kinds of procurements.
But it's interesting
clearly
that you say
it looks like there's a lot of issues that still remain, and I think that's what I could see from the quote from the AG's office. It's still active.
So who is handling the procurement? Because I know Senator Sabina Perez said that they didn't have procurement experts dealing with this. So who is handling the procurement on behalf of the government of Guam in response to COVID?
Well, I think that agencies, normally the clearinghouse should be at civil defense, and then they would work with the chief procurement officer and move things forward. That's what it should be.
Okay, so we're talking about Claudia Ekfaji, and who at civil defense?
Should be. So what happens when you need resources? You have to fill out this ticket, and it goes into civil defense, and then they go and check they're supposed to go check the funds to be identified, and then get all the formulate the procurement through the GSA process. That's how it should be.
That's not how it was done, though, right?
I don't know, because I'm not. I need to learn more myself. I guess I don't have the answer to that question.
Mm-hmm. Okay, so you're not sure.
I'm not sure.
Okay.
So I mean, it's interesting because in just following the paper trail, you said that it's supposed to go through GSA, and I mean, is this or is it not very similar to how we do emergency procurement after, let's say, a typhoon? Is the process supposed to be the same?
I think so. There should be that. There's a standard. I think that what I've been reading is that there's certain fast track actions you can take under public health emergency, but if we have an expectation of getting it paid from federal funds, then we have to use the federal standard as the way to procure.
And so what we've seen in the release of these emails from the governor's son-in-law and legal counsel is that he's kind of calling all the shots. And I don't know, is he the acting chief procurement officer, or does he have that authority as the legal counsel to the governor? Because the process you're describing and the way that it's supposed to be done sounds pretty different from what actually had happened. And I know you're just getting the info like a lot of us.
I am. And so, I mean, I can't give a comment on that I don't know.
But according to how the process works, it goes to the chief procurement officer?
The chief procurement officer always has the authority. And so, and her office has been supporting a lot of the activities already. This transaction, I just need to learn more of the details and expect to hear how she reviews and makes her determinations as to what has transpired, and making sure that there has to be accountability in everything, for sure. Her and the Attorney General's office would definitely play the role in this.
Okay. And, we were reading through this letter from FEMA was in response to something that Charles Esteves had wrote, and Mr. Fenton was very clear in his response that in terms of reimbursing money that's spent, especially for PAC-STAR and the quarantine facilities, these non-congregate shelters, that there has to be mechanisms in place. You have to be able to say who's been in the room, how many meals, etc. Do you know if these mechanisms are in place to track who's staying at these quarantine facilities, these isolation facilities, whatever facilities that the government of Guam that we are paying for?
I would expect that. Absolutely. They need to have a record, and there should be a record. I mean, don't forget that the people that are going into quarantine are being admitted there under public health directives, and public health has been keeping track of everybody in under surveillance, in isolation, or in quarantine. So I think that it will be easy to match up those names, because they're coming in on the airplane, staying the 14 days, and then submit that. I would think that on a daily basis, for sure.
Do you think a one-night stay for Tony Babalta is something that's reimbursable by FEMA because he wasn't feeling well?
No.
Can we just get you real quick on that, LT? What are your thoughts on this? It was just such a whirlwind of events that led to.
It is. I think that that was a mistake. He wasn't feeling well and he stayed. He probably shouldn't have, because the facility was for quarantine. But I'll just say that his departure is a big loss, including for me. I mean, he's been there since day one. He was a key person that helped enable and execute the Treasury relationship to get the reparations paid. He has been very forward-thinking in our posture with the federal government, with the military, with the Department of Interior. I think that it wasn't good judgment on that issue, but on the whole, I would say that it's a big loss for our administration.
Right.
Yeah. Right, but do you think it's just this particular incident that said, I quit? Like,
isn't he the authorized
more to it?
signatory for the governor? So he can sign on behalf of the governor. So what I'm thinking was, I mean, he really resigned over a one-night stay, or was it something else with maybe these things like this hotel procurement that he's helped organize with the governor's son-in-law? Is there anything there? And then I guess my next question would be, is if you're saying the procurement is supposed to go one way, which it's not rocket science. I mean, I'm pretty sure you've been involved with, post-typhoon emergency procurement.
I did a lot.
Right. So, and when you're saying it's supposed to be one way, but we have a paper trail showing that the governor's son-in-law is acting with such unilateral authority to make these calls, and no one is saying, hey, wait a second, that's not how it goes. Is he going to be held accountable for this? Because it kind of seems like they got to go back to the beginning and now pull all these quotes and they're kind of like are they trying to recreate a procurement record that doesn't exist? And if so, are we going to go ahead?
You cannot be recreating a record that doesn't exist. I think you can go back and assemble all the details, the supporting documents. On top of this, no matter what, all the financial transactions, COVID or not, are subject to audit and have to go through review, and there has to be a finding. I mean, there's things that I don't think that the decision is, or the opinion of what happened is going to occur immediately, because there has to, they have to go back and take a look and see what happened at the time that they made the decision, considering it's an emergency and you have a logistical issue with hundreds of people coming inbound at the time,
right,
especially from the Philippines. And so, the legal counsel, they have ethics. I'm sure he relied on that to make those decisions, and all of that will be reviewed by all of the third parties and the internal controls of the government that are part of the institution of the government and devoid of the political side of it.
It kind of seems like if Tony Babauta is going to resign for a one-night stay, or and that's kind of what. I mean, I know it's personal reasons, but we can kind of put two and two together. I mean, if he's going to resign over that, then you would kind of expect that the governor's son-in-law legal counsel, I mean, obviously this whole procurement didn't follow the way, the process that it's supposed to. So I'm just thinking, is he going to resign next, or is there going to be any kind of repercussion for this, or are we just okay with it because...
I can't. I'm not sure how to answer that, Chris, right now. All I say.
I mean, do you have the authority to ask those questions, or is he just under the governor? Because I know it's got the governor and lieutenant governor.
I think that all of this issue will surface because that's the responsibility that we have, and then the folks that. Authorities that can come in to make those determinations will do it, and those will come in from GSA and the AG's office.
Right.
Because of the way this procurement or whatever this was for these hotels, these quarantine facilities / isolation facilities were handled, in your opinion and your experience, would this raise a red flag with FEMA in terms of reimbursement?
Sure. Yeah, of course. They have to... Any large transaction it's not necessarily a red flag, but everything will be scrutinized. even the best procurements have to go through the scrutiny and make sure that they're in compliance, and only then will they get paid. So for sure, this one, I think definitely on all fronts, all the details of this procurement certainly will have to be reviewed, and there will be determinations made about the process, if there are any corrections to be made in future transactions, if there's an affirmation, given the circumstances, and those will all be made, and those will all be public for sure.
LT,
go ahead.
Okay.
No, I was going to ask, what are your thoughts on Linda and Pinko DeNorsi publicly stating that her signature on these documents...
I got a statement.
Okay.
Okay, so I'd sent Linda a question early this morning. Linda, can you confirm your signature was used without your knowledge to sign the hotel quarantine procurement documents? She responds, Chris, I want to make it clear that I have nothing to do with quarantine properties and quarantine hotel negotiations. Yes, I recognize my signature, but it was an electronic signature, and I don't recognize this document because I've never seen it before. Linda DeNorsi. And so we had Senator Sabina on earlier in the show, and she straight up said that's fraud. So, I mean, maybe that provides more context into what I'm saying about the governor's son-in-law and legal counsel, leading the charge in this procurement. And look at all these problems that are coming. I mean, he's just using people's signature. I don't know. It's kind of sketchy.
We don't know if he's using her signature.
Well, I mean, somebody's using it. Her signature got there. She never saw it. And I understand that, people's signatures are needed. And I also think, is he authorized to just stamp Linda's signature on things that she doesn't even know?
He's the one stamping the
Well,
signature.
whoever's stamping it, somebody...
Well,
I'm just making sure.
Even that digital, there should always be and I believe that at least for us, there is a process if you're going to get a digital signature. But I discourage that. But sometimes they are necessary. And your question was, what do I think about Linda's comments? I would stand behind her comments. She is the one that knows if. Is the only one that can give her approval on using her signature and her authority.
Right, yeah.
Were you aware, though, that people are using digital signatures?
Do you think there's anything out there with your digital signature on it that you don't know about?
I can count on my one hand that the only thing that I've authorized digital signatures have been for proclamations that needed to be that I might have already signed, but they wanted to add more things, and I saw it, and I was out on the road, and then I authorized my digital signature. But other than that, I'm not in the line for signatures for any of the financial stuff. And if and when I do, because I'm acting governor or such, then I learned a long time ago that your signature is your most valuable thing, and be reserved with it. So I would want to sign it myself.
Right. Mm-hmm. Yeah.
That way you can see what's going on, and make sure that everything is up to par and is, what you're understanding you're signing.
It kind of seems like that alone would be something that would force a resignation, that you used a public health director's signature without her knowing about it, and she never... I don't know, it just seems like that's probably way worse than spending the night at Pack Store because you got a tummy ache or whatever.
I just have to see what how the details are revealed.
Right.
For me at least, to make a comment on that.
And again, I got to say that I appreciate you standing in. You knew that we were going to ask these questions, and to me, it's like going back to that press conference Thursday. How hard would it have been for anybody to answer these questions? And it would have been done.
Yeah.
It would have been done. It would have been done. That's why I just don't... it's so easy to answer questions.
Myself, just my luck. The one press conference that I went to is the one that had this issue.
You're like, what the hell? Oh my! And you could see the look on your face. It was like,
yeah, you could.
Mute.
All right. I have to go, but can we
wait.
at least a bit more on the positive note?
Yeah, but I think Bree has one more question, and then we'll
get...
Go
ahead.
Yeah.
Okay, so I know that the last time we were talking about this local CARES Act money, the $118 million, you said that there was some plans in the works to help some unemployment people. unemployed people? What?
So that's still the intent.
Mhm.
Details are being worked on right now, and I would just telegraph that announcement is coming up. But
Like at today's press conference?
Right.
I don't know that. I can't guarantee that.
Man, LT, I know I said one more, but just
If
and
I
then
can
we'll.
guarantee things, then I'll say it. But if I can't,
Right.
I can't.
We're getting so many comments about update on the stimulus checks. That was one of the questions.
Sure.
Can you just give us that and then
Yes,
do
I
your
can.
positive
I
thing?
can.
Okay, go for it.
So so I know that Revenue Tax and IRS have been working through the weekend, including yesterday, having a marathon phone call with IRS, inching towards getting this approved. So that the last time that they met was basically for about 3 or 4 hours yesterday morning. And Daphne's been out there with her team. So I feel that that's positive. Unemployment, on the unemployment side, we have a whole bunch of employees in the government that we assign to Department of Labor to help stand up that program. They're going through the federally mandated training modules as we speak, so that they'll be able to go in and process applications. And the employer module for HireGuam.com, which is going to be the first step, in getting unemployment payments paid out to employers, has gone live. And I believe that some employers that already pre-registered on Hire Guam will probably get queued to go in and start filling up the information so that they can be. Some of them have already been validated as bona fide employers, and the next step now is receiving the list of the employees that have been furloughed or laid off into the system. So that has just gone active. And employers should visit HireGuam.com to go forward. There probably is, there's some intricacies once these get done that, there are some employees that their payroll continues because their employer was approved with the SBA program. And this process will help determine when that stops or who didn't get that, so that they can, the pipeline for the unemployment assistance would be made to them. But I'll just caution that this is a huge step, but this is just still the first major step in on the unemployment side. Mm-hmm. And then the other thing I wanted to say, which is not the bright spot I want to talk about, is that you can tell from the news reports that the plan for homeless
I was going to ask.
has to be modified and changed. There's some infrastructure problems. There's all sorts of issues that have arisen that are being looked at right now, and more to come.
Right.
That's,
yeah, I know.
I would just say that's
Frank Mansell was saying that the tents that the government was wanting wasn't what Health and Human Services, I guess, requires in order to.
Right. There's all sorts of, there's the public health side, because they don't want, like I said, ever since the beginning, the pressure has been trying to make sure that they don't have a situation where clusters are being formed and COVID or other diseases might be spreading because people are congregate, versus the need to shelter people because they're just out there. This is still, I think that the details they're still pushing forward, and I'll find out more today what's going on with that. But I would just say that is that one is disappointment, and for sure we are behind on that. Mm-hmm. So I need to go, but I just wanted to say the bright spot for me was seeing everybody practicing their social distancing when Santa Maria and Cumberland went throughout the island. I think that was very positive for our people. And I just think I'm grateful for the Archbishop for doing that for everybody in times of really desperation or in times of hurt. And despite your religious beliefs or non-beliefs, there's no question that that is a positive thing for our island and for our people.
Well, amen. At least we can end agreeing on something. I totally agree with that. That was awesome.
Okay.
Thank
you, LT.
Are you going to be at the press conference?
We'll see.
I don't know. After this phone call, they're gonna.
But if you ask me something and I'm at the press conference, I'll answer.
Okay. Thank you, LT.
Thanks.
All right.
Okay,
Take
There
care.
you go. 8:34. Well. Dang, I wonder if the governor's legal counsel needs a wrench while he's under that bus. There's an oil pan under there. You just a little thing, and then you.
Yeah. You know, you could always count on Josh to come on and answer questions. It may not be the answers, you know.
I mean, he said, "Hey, I don't know the answer to that
I'll
question."
just admit, don't know.
What'd you make of that, though? I'm almost scared to ask you.
What do you mean?
I mean, just his comments. It kind of, I'm a little surprised. I thought they were going to do more to protect the governor's son-in-law and legal counsel, but it kind of seems like people are just like, yeah, this is not how you do emergency procurement. And I wonder if it's his inexperience, because I don't believe that he has experience advising a governor at this. I mean, I'm pretty sure he's never been an advisor to a governor anywhere. But this is a whole different ball game than, you know, little lawyer ball. This is big time. This is the big leagues. And you know what's,
and it's a major response effort. You're talking about people, thousands of people that don't have a job, waiting in line. And I know I keep saying this over and over, but that's just the facts.
Yeah.
That people are suffering.
And when they hear about, you know, hanky-panky going on with, you know, chief of staff overnighting, with now we have other staffers who are also given the rooms at the Pacific Star, it just kind of, and that
even
coupled with everything else, right?
With Rebecca and Alice, both directors of government agencies. So
they're getting the COVID. Are they getting the double pay or what?
I don't know, but so you mean to tell me that they're delivering towels?
Yeah, I don't buy that. And I mean, you know, that statement though, and I forget. Maybe we could go over it when we do news. If we have time to get to news. But that statement implied that it was just Becky and Alice alone in the hotel, getting calls at 2 a.m. We need a towel, and they go, "Oh, sorry, Alice, I got to go deliver this towel, and they need more little shampoos in room 308." It just sounds kind of like ridiculous, you know? And then when I asked Carlo, hey, how many other people are staffed there? He was like, oh, let me get the numbers, and you know, I'm waiting for that. But obviously there are other people who are working the quarantine facility from the government of Guam.
And that might be covered.
Right, yeah.
For wraparound services or something like that under FEMA, but definitely not a one-night stay because you're not feeling well.
I almost said one-night stand.
You did. You were like, when
I just said one-night stay sounds so much like maybe it was a Freudian slip.
All right.
Okay, I just got another comment from Linda here because I want to get to her before they get to her. So I'd asked her.
I just got that.
Do they have your permission to use your digital signature? Also, would you have signed these documents if they presented them to you? Her response, who is they? And I put representatives from the governor's office and the legal counsel. And her response, Chris, the procedure is that I get a call from legal counsel for permission to use my signature. And if I authorize it, then the document should be sent to me. The second part of your question, no. I will not sign these documents if they presented them to me, because I do not deal with procurement of quarantine and isolation facilities. Linda DeNorsi. And I think Linda is practicing what I like to call political distancing. We also saw the lieutenant governor practice political distancing. That was a little more than 6 feet away, too, from...
Yeah.
Sorry. I mean, it just basically looks like Linda is like, hey, I'm not involved with this. You didn't have my permission to use... I mean, it is. That's what she's saying.
Mm-hmm.
So we're still waiting from the response, you know, and I know they're probably... How do you respond to this,
And
though?
why would her signature, if she says that it's not... She doesn't have anything to do with procurement...
Right.
Why would her signature be required? I know that the governor has said during a previous press conference that Linda is in charge of COVID response.
Right, yeah. So I think that they obviously maybe used her signature because you're right. She's supposed to be running it, and that was probably maybe required for an attempt at reimbursement. I don't know, but, you know, I got to call out the AG again. So it really seems like the AG is just nowhere to be found on this. And the comment we had got again from Carlina, the spokesperson, we cannot comment on ongoing procurement, but our office's role is to review contracts for legal compliance, including laws that are triggered when a public health emergency is declared, and we will continue to fulfill this duty. So that's what you get from your elected attorney general. Is that even 2 sentences or what? It's 8:38.
I don't know, but I sure want this apology, and I
Yeah.
hope it's at the press conference.
Me
since
too.
You treated
We're waiting
the
on
media
our apology.
like crap
Yeah.
during a press conference. So yeah, I'd like to hear that apology during the press conference, so everybody on this island can hear it.
Yeah, no, I mean, you don't got to apologize to me. I'm personally,
good,
I'm over it. You got to apologize to the people of Guam. And I want to see that. I want to see Janela Carrera and Carlo Branch out there apologizing because, hey, and it's not us. That's your lieutenant governor who said it.
Yep.
So that was definitely a...
Yeah. So save your phone calls. Say it at the press conference to the people of Guam.
Ooh. All right, 8:40. We'll take a break. We're going to come back. I got Tess. We'll get Tess on the phone, talk about these benefits, SNAP benefits. It's real important. A lot of people have been asking about that. Again, on KUAM News' takeover.
Did we get permission to get Tess?
Yes, Linda gave me permission to get
All right.
It's 8:40. Good morning.
GU Self Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Be healthy. Be informed with ITD.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
Be healthy. Be informed with ITD.
In order to win this war against COVID-19, it's going to take all of us to do our part.
We are all frontliners in this epic battle.
And on Tuesday, May 5th, we're asking you to answer the call to help by taking part in Giving Tuesday Now.
It's part of a global initiative to set aside this one day for the pandemic crisis.
To step up and give a donation to any of our island's nonprofit organizations.
The hospital, the Mayor's Council of Guam, or any of our frontline workers. Whether it's PPEs, gloves, masks, canned goods, no donation is too small. Anything and everything will help.
And if you make your donation, take a picture, post it on social media, and use the hashtag GivingTuesdayNow and GivingTuesdayGuam.
And then later that night, make sure to tune in for our half-hour special Giving Tuesday Guam, Together We Give. We'll showcase how everyone is taking part.
Be healthy. Be informed with ITD.
I know that she has joined the chorus of voices calling for transparency from the administration. We got a whole lot of transparency, probably too much for some people's taste. With Lieutenant Governor Josh Denorio on the line. You know, someone had messaged me because I had made the joke that Lieutenant Governor is practicing political distancing. And this person, one of my friends, chimed in and said, hey, I think the public auditor and the attorney general aren't just practicing political distancing. I think they're practicing political isolation. 8:46. Let's switch gears a little bit, and then we'll probably jump back into the conversation with Speaker Barnes coming up at 8:46. Let's get Tess from the Department of Public Health and Social Services on. Tess Archangel. Good morning, Tess.
Hi, good morning, please.
Can you please put your mouth near the phone and speak up a little bit? I'm sorry.
Okay.
Okay, there you go. I can, yes.
Okay.
Tess, so we just wanted to get you on and talk about the procedures for applying and for the SNAP benefits, because I know you guys have seen, I saw something somewhere, you have seen the number of people, is it applying or receiving SNAP benefits? It's tripled, right?
Yes.
So which is it? I'm sorry. Is it they applied or they were approved?
They were approved. Those are processed. Those are approved cases. Mm-hmm. You know, in one case, there could be 2, 3, or 5 in a household that were, laid off because we processed the application by household for SNAP, by household size.
So how many were approved? I'm sorry.
942 applications for April.
For April.
Yeah.
Brand new. Okay, and this is for SNAP. This also includes the Medicaid, the MIP, or that's just SNAP.
Some of them, yes.
Okay.
Because the income guideline for SNAP is higher.
Right. Right.
Mm-hmm.
And how many applications do you still have pending?
Currently, the total applications pending for new applicants that we have interviewed is 37, and then for reopen is 54. That is because, the applications are incomplete, documents needed to verify their citizenship and everything is incomplete. They haven't submitted those. But our staff has been calling all the clients to submit those, and some of the applications doesn't have signatures. Some of the application has only first and second page, so they did not complete. So they have to resubmit those applications, and we call them.
Okay, so what about for April? Because you said 900 in March. How many new applications?
New and reopen, there's 306.
So total since March, there would have been over 1,200 new applicants that were approved for public assistance.
That's cases. So as I stated earlier, a case could have 2, 3, or 4 in a household that were laid off.
Mm-hmm. And then you have the pending approval. You said about 50?
54 for reopen and 37 for new applicants. So that's roughly 91.
Okay.
Yeah.
And Tess, so you said that any delays that people might be experiencing with the process, getting into the program and getting the benefits, it's more than likely because they didn't complete the necessary paperwork or there's information missing, right? So what would you say to those people who are sitting at home kind of wondering, Do they got to call into you guys, or how does that work? Or are you guys the ones who kind of reach out to these people?
We call them. We call all of them. And sometimes, we experience the phone number that they give is from their relatives. So their relatives will tell us that we're going to relay the message. That's the issue also. And some clients, they don't have minutes or load on their phone, so we cannot continue interviewing them. So until such time that they have enough load on their phone to interview them.
That's kind of tough because they can't, obviously they don't have the minutes because they're hurting so bad they're applying for the SNAP benefits. So how do we, is there a way we can remedy that, Tess?
Unfortunately, interview is a required, telephonic interview is a requirement of SNS if we cannot do face-to-face.
You said that the threshold was raised, correct? The criteria, the income. What's the maximum amount that a person can make that can still apply for public assistance?
That depends on the number of households. Yeah, it depends on the number of households.
Okay, because what are you guys seeing people that don't meet that threshold but are calling and saying we need help and we'd like to apply, but they're being turned away because they don't meet the requirements?
Not turn away. Anyone can submit their application. We don't tell them not to submit their application. We tell them to just go ahead and submit the application.
Have you had
to? The non-U.S. citizens as well as the non-legal permanent alien are not qualified under SNAP.
So how many have been denied?
We have some denials. I don't have that on top of my data right now.
Right. Okay.
So there have been denials.
There were some.
Okay.
And is that because the way because I've applied before? How much of a factor are your assets in terms of qualifying for these benefits? Because what I hear from my friends, and I just want to vet it through you, what I hear from my friends is that they don't qualify. They're not working, but they don't qualify because they own a house or they own some cars or whatever. So these are people who, were gainfully employed, have either been laid off, hours reduced, or furloughed or whatever because of COVID. And so they're saying that, and you see it in the comments, a lot of them are saying we just don't qualify for it. So is that accurate?
No. For SNAP, there's no asset test.
Say again?
There's no asset test.
So there's nothing with assets that affect your eligibility for these programs?
They can qualify. The assets are not being counted.
Okay. So maybe they just think that, because I own these 2 cars or whatever that.
Oh.
So what criteria is used financially when you apply?
Your income.
Okay. And is it your income right now today?
Yes.
Okay. So if I got furloughed, laid off, 0 income, no matter what I own, I could qualify.
Yes.
Okay. That's good to know.
Okay. Anything else you wanted to get out to the public?
Oh, I would like to remind them to complete the application form, like especially the citizenship, who is the head of household, or what are the relationships within those households. Those are not being filled out. Yeah, just tell them that they don't need to submit the documents for an employment because we do contact their employers or mayor's verification. We just need verification of citizenship, their residency. Those are the social security numbers. Those are very important.
There's a question here from somebody that is asking, why are they asking for last 2 check stubs when no one has been making income since March?
Yeah, because that's the process. So they they can just state they don't have any income at all and they got laid off since March. And so the state workers will verify that.
Got it.
With the employer.
Okay.
Thank you for that, Tess. Appreciate it.
Okay.
All right, take care, Tess.
Wash your hands, Kay.
Thanks for everything you guys are doing.
Always.
Okay, good.
Thank you.
Okay, bye, Tess.
Okay, bye-bye.
Yeah. Yeah, make sure you guys fill out your application. I know it's hard. There's a lot of stuff on there, but, you know, from what Tess is saying, if maybe you're experiencing a delay and, you know, getting the call back is, I mean, that's sad. The reality she said about people not having minutes, I mean, that's so real.
Mm-hmm.
I mean, you're going to choose between, you know, a bag of rice or minutes.
Right.
What's that decision going to be?
And real quickly, just a developing story that we're working on.
Right.
The Guam Police Department, they are currently conducting a death investigation along J.A. Camacho Street in Mongmong. Police spokesperson Paul Tapau, he's on the scene. We're just waiting for more information from him. But again, there is a death investigation that's occurring right now as we speak in Mongmong on J.A. Camacho Street. And we understand it's at the Titano Apartments. Again, we're still waiting for information. There may have been a shooting that may have occurred. There is a death investigation. We're still waiting for information from GPD. Are you calling someone?
Yeah, I wanted to get Maria Pangilinan on, just like we got a couple minutes. They're doing packet pickup and all that. So, I mean, with people hearing all this news now about these shenanigans that... I like saying that word.
Shenanigans.
These shenanigans that are going on. Maybe you're thinking, hey, I think I'm going to run for senator or something to kind of get in there and hold these people accountable. But
Let's try calling Paul Tapau.
Okay, go ahead.
I can't just say hello. Yeah, so we're going to try and get Paul Tapau, spokesperson for the Guam Police Department, on the line. As I just mentioned, there is a death investigation that has been launched along J.A. Camacho Street. We're hearing there could have been a shooting, which has resulted in a death. So a death investigation is underway in Mongmong. And hopefully we can get Paul Tapau on the line to give us a little bit more information. But that is what he sent out to us. That's the preliminary findings, as he would typically say, that there is a death investigation underway into a possible shooting, from what we understand, that occurred along J.A. Camacho Street, and we're told it is Titano Apartments. And so we're not having any luck, I guess, getting him on the line. But we'll try to get more information to you just as soon as we get the information. I know Adriana Catero and Nestor Lecanto have placed their phone calls. So once we know more, we'll pass it along.
Well, definitely. We're going to take a little break, and we're going to go over to the CNMI and touch base with Tomas Maglotnia, who's got the very latest on COVID-19 in the Northern Marianas. It's 8:58. We are KUAM-FM in Agotnia, Guam.
Local.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
informed with ITD. Be healthy. Be informed with ITD.
Sesuhami mandai gizanan Gatsu Hungu kinopu Zapapampang hihiluyatsu Humugu gitatala Yochugi ukule.
Hey, it's 9 a.m. Good morning. Wow, what a show this morning. Like we always say, real information, real time. And you can always tell when we're informing our elected leaders about what's going on.
Yes. Oh my goodness.
Yeah.
It's a lot of information or not information.
Yeah. Man, getting a lot of comments here about Lieutenant Governor Josh Tenorio's phone call. I would say that was pretty explosive. Pretty explosive in how he came down on the way this procurement of these hotels was handled. He said there's a way to do it, and the way they did it ain't the way that you're supposed to do it.
Mm-hmm. He talked about the digital signatures.
And Linda Pinko Denorsi is coming out pretty firm and saying, I had nothing to do with this. And you got to wonder, the federal authorities, is this something, Bree, that, I mean, because I mean, you have the experience. I'm kind of still a newbie.
You are not a newbie. Give me a break. You're just trying to play innocent. You playing innocent.
Okay,
no,
so
obviously, Josh said that, when we asked about Tony Vivata, is that something that would be reimbursed by the feds? Of course, he said, oh, hell no.
Right.
No, flat out no.
Yeah. So
he didn't say hell no, but he did say no.
I wondered, though, with them using these CARES Act funds for this this procurement, and it's so weird to me that the AG is not out in front of this, It's just weird that he's not saying, hey, yeah, I'm going to look at this. Instead, he's just saying, like, oh, it's still ongoing. We're going to look at it later. We're only open for an hour. He didn't say that, but they did say the statement was that this procurement is still ongoing. So that's pretty interesting stuff. But let's head over to the NMI.
A lot of interesting stuff.
Yeah.
And I have to bring it up. Like, he said that the media deserves an apology. The people of Guam deserve an apology.
And who's that? Who did our lieutenant governor say should apologize to the media and to the people of Guam? Because he didn't just say they, like, he mentioned specific names. And when you mention specific names, I'm assuming at Lieutenant Governor Josh Tenorio's level, he might be in the know. And if he's telling us that Janela Carrera and Carlo Branch need to apologize to the people of Guam and the media, then I'm
to the people of Guam.
I'm not
because
I
know the first question that was asked was from Jasmine Weiss from the PDN.
Right.
Status of the stimulus checks.
Right. And, Lieutenant Governor answered that in like 2 minutes. It was so easy.
Yeah.
So this bonehead decision, apparently it appears to be a decision that was made. Because why do you make people who weren't responsible apologize? You just don't. Mm-hmm. You make the people who were responsible for the call apologize. And according to Lieutenant Governor Josh Tenorio, those people who should apologize are the governor's policy director, Carlo Branch, and the governor's communications director, Janela Carrera.
Yeah. So why would Carlo Branch need to apologize?
Well, because
it was his call.
I like I said, I just got to go back to saying that if the lieutenant governor of Guam tells you that he thinks people should apologize to you, then I'm assuming the lieutenant governor of Guam knows that those are the people who are responsible, or maybe they're just getting thrown under the bus for it.
Yeah. Oh, phone's ringing.
Yeah, that's the speaker. So let's get Tomas on here really quick here. Tomas, let's go ahead and talk about, actually, let me just...
All right, Tomas, what's the latest going on in the CNMI? Because there was a lot of developments over there. Are you there?
Yeah, he's here. Okay,
Tomas?
so Tomas?
Hi, good morning, Brandon.
Good morning. With the very latest from the CNMI, Tomas Maglotnia. Good morning, Tomas.
Good morning. So, update from the Special Assistant for Homeland Security and Emergency Management, Gerald de Leon Guerrero, shared over the weekend. Another round of personal protective equipment arrived on Saipan early this morning for the first responders and medical workers. This includes N95 masks and gloves for COVID-19 response. We wanted to share a little clip from him over the weekend. Take a listen.
Good morning. We're here at Saipan International Airport again to receive another batch of PPEs. These PPEs will go a long way for our doctors, nurses, and our first responders. Good morning. We're here at Saipan International Airport again to receive another batch of PPEs. These PPEs will go a long way for our doctors, nurses, and our first responders.
Also breaking over the weekend, announcing a reduction in curfew hours, the CNMI Governor's Office announcing this over email, the Governor's COVID-19 Task Force saying that effective May 1st, the CNMI's curfew hours are now from 10 p.m. to 5 a.m. Business hours, they add, that will continue to be open only between 6 a.m. to 6 p.m. and must continue to implement social distancing. The mandate says that they should limit the number of customers within public facilities to 50% of their regular occupancy. They clarify that gas stations may be open for the dispensing of gasoline only outside of these curfew hours. They say that such an extension will permit persons to exercise in cooler temperatures and expand the hours for fishing. The NMI Governor's Task Force also announced that all inbound travelers to the CNMI have the option to stay the entire 14 days in quarantine or be tested for COVID-19 and stay in quarantine until those results come back negative within maybe 3 to 5 days. And it was last week when NMI Congressman Kelili Sablan also noting in his newsletter that the public on Saturday should hear about the disclosure of the $36 million of coronavirus relief funds from the CARES Act. He says that the Treasury's guidance on permissible uses includes payroll for medical and other essential workers in the COVID-19 response, but the funds can also be used to make online learning available for all Mariana students. After that message was released, the governor's office late last night releasing the plan for the $36 million in CARES Act funds that the NMI congressman was asking about. Some notable numbers are $11 million for the procurement of COVID-19 test kits, PPEs, first aid kits, disinfectant sprays, and sanitation equipment, $10 million to support payroll expenses for first responders and public safety, human services, and support staff related to the COVID-19 emergency and response. We also learned that of this amount, $200,000 are used for rental costs for the off-site quarantine facilities, which are the Pacific Islands Club and Kanoa Resort. Even with this recent disclosure, Congressman Ed Probst writing in part this morning that at a time when massive furloughs are happening in the government, Congressman Probst says that we must know where the money is being spent. He says that we must know who is being awarded sole source contracts and all new jobs and new hires. Again, that's coming from Congressman Ed Probst after that disclosure late last night. Also wanted to share the latest numbers in the CNMI as of May 4th. The number of confirmed COVID-19 cases remains at 14 with a pair of deaths and 12 recoveries. And so far through the community testing initiative, they have tested a total of 1,335 people. Brian Chris will be speaking with the Commissioner of Education, Dr. Alfred Ada, 11 a.m. on KUM's Facebook, and we're trying to get the Chamber of Commerce to talk about their perspective for reopening the CNMI.
All right.
You said over 1,100 tests were conducted, and these are serological tests, right? The blood tests? Or were they swabbed? Okay. Yeah. And they were swabbed, right? They were swabbed.
Yes, there's
the nasal swabs.
So 1,335 as of May 4th, and again, no reports this morning
on the
of any positive cases from these tests from this morning.
So since the testing was conducted at the airport, have you guys been getting the results, or just these are the number of tests we've conducted?
We haven't been getting any results. We haven't heard about the number of negatives or the number of positives, though I can confirm through speaking with many community members that results are being released. All of the community members I spoke with, about maybe 5 to 10 community members, said that their results came back negative. And so we know people are being informed. We haven't heard the total amount, though, of those who are negative or those that are pending or those who might be positive and under investigation. So the numbers, the 1,335 number is just the number they provide on a daily basis in terms of the cumulative number of persons tested. Bring Chris, we just don't have those numbers yet, and we're, of course, continuing to ask for them, especially if we could get numbers on how many negatives they have so far. As we know, community members are already getting the results as of Friday last week.
Mm-hmm. Do you guys know how many people are in the hospital?
No, I don't have that number right now, but I see that local media are also reporting that there are, still some people who are either in quarantine or isolation at the hotels. I'm not sure if that's because of traveling. We know that about 38 passengers came in through United on that first flight back, and all the process for that still applies. As I said, there are 3 different options for any inbound travelers. The first one is you just stay for the 14 days at the hotel. The second option being that you stay at the hotel, get tested, and maybe be released within 5 days. And then the third option is if, for example, someone on Guam gets tested and that test being valid for about 72 hours from the collection of specimen, then they're released. And so those are the options right now. I'm looking at the CHCC website online and seeing that so far the cumulative number of persons released from these quarantine sites is 265. And so, of course, we're going to be expecting that number to climb as more people are returning to the NMI. We're hearing that many of them are NMI residents who weren't able to come in because of that cancellation, because of the delayed flights over the month of April.
Mm-hmm. All right. Thank you, Tomas.
Thank you both. Have a great day.
You too.
All right. Wash your hands. Bye-bye.
You too. Thanks.
Okay. Sorry. Okay, 9:12. Let's keep it going here, and let's get the Speaker of the Guam Legislature on to the show here, Speaker Tina Munia Barnes. Good morning, Madam Speaker.
Good morning.
Manana Suzulis to you, Chris and Sabrina.
Man, Speaker, can we just get you up really close on the phone? Because last time we had you, it was so low, and I if you just could, just so the people can hear you.
Can you hear me now?
A little bit better, maybe a little closer.
Okay, I'll try my very best.
Okay.
I'm right here.
Okay.
I'm right at the phone.
Okay, Speaker. So I guess first of all, we understand there was a letter that I saw that you had written about transparency. Can we just start with that and tell us what went into the thought of putting out this letter?
Thank you very much, Chris and Sabrina. And I just want to share with you that as I continue to work with my staff and my colleagues, I want to share with you that I wrote 2 letters. One to the public auditor, Attorney B.J. Cruz, and then to our governor. And if I can share my thought process with you, I've been researching this matter and spoke to the National Conference on State Legislatures on what we should do as far as transparency and accountability. And it was recommended to us as colleagues that that NCSL told us, given the importance of COVID-19 and the resources that the states and the territories were going to get, that we literally should give the opportunity for the public auditor to be given authority to perform audits on these measures. And through my research, I want to share with you that our public auditor, the Office of Public Accountability that I have oversight of, has the authority to conduct audits on everything as it relates to Guam, except for the records of individual taxpayers. And let me give you an example to that, Chris. Meaning, if the public auditor cannot make sure that the economic impact payments that actually went to people who deserved it, meaning if you, Chris, or Sabrina get a stimulus check and take, for example, you make over $77,000, the public auditor cannot prove that you make that much because he cannot see that. But I did ask him for the opportunity to show the people of Guam that we're that the administration and the people of Guam would be transparent, that given the authority by the administration, that we would go ahead and do these audits. So I also wrote a letter. So that letter was written the last part of April. And then on May 3rd, which was just recently, I think I wrote a letter to our governor asking and telling her that I continue to hear the cries of our residents and that I totally, stand by them, and that, we all deserve answers, and we want to be able to better understand what process is going on. And while I share that the public auditor has broad jurisdiction, I know that if he's going to do these audits on the numerous programs like the PUA, the unemployment insurance, the CARES, the CRE, and all that, all these programs have over $100 million on it. He's going to have to get the resources in order to do that. And I am recommending that since these costs are to audit the COVID-19 fund.
This letter, though, these letters that you sent yesterday to the governor, was it before or after the meeting you had with her? And before.
Before.
I see.
Wait, yeah, before, the night before. Today's the 4th, am I right?
Right. Yes. May the 4th be with you.
It was early morning. And I was asking the governor, out of the money that has been received to date, give a small portion of that money to restore our public's trust in our government, and to make sure that all the monies that were received get audited, and that to make sure that we're using the money in the correct manner. Because, mind you, if we make any discrepancies and mistakes, we may, fall into the possibility of having to return federal grants. You and I know that if in any way that we expend funds that are not authorized, then it would have to be returned. And I pray that is not the key. And I know that shouldn't be the key. But I just want to share with you that I even gone further, and I understand, Sabrina and Chris, that even if Guam has been the first to apply for everything, if not almost everything, all of it, we still are waiting. And I understand the frustration from the administration. I understand the frustration from the community, or even us as policymakers. We've been asking, but we already have received funds as it relates to the coronavirus relief and funds. And I want to make sure that there's a plan. I know that the oversight chair on OFB, Senator San Agustin, has also asked, where's the plan? Where's the budget plan that we can share and that we can look at, so that we can tell our people that this is what's happening today. And I'm really hopeful that after the meeting yesterday, that we're going to continue being apprised by the administration. We're going to continue to get updated reports. We're going to continue to get the plan, and we're going to continue to see what the financial impact is as it relates to the governor having that transfer authority to move funds from point A to point B.
Right.
Speaker, and I'm going to share with you, we cannot do that alone without the information being provided to us. So, yes, in all fairness, from the legislature to the administration's part, in order for us to proceed moving forward with an understanding that there is accountability and transparency, we're going to have to work together.
Right, Speaker, and it kind of sounds like, from what we've been able to piece together with Senator Sabina Perez, and from what you're saying, is that was there anything in this meeting where there was a conversation that, hey, you guys don't need to override that transparency thing because, we're going to start being honest right now today? So are we still going to override the governor's veto of that transparency bill from Senator Teresa Laya? I guess that's my first question. Where are you on that?
Well, I just want to say, after receiving hundreds of messages from constituents asking for transparency and relief for our displaced worker, I want to say that that I think it's important that if the administration is going to be upfront, that they wouldn't have a problem with us letting this become statute, because it is just a fair request to ask that the accountability and transparency be there, and that's what Bill 333 asks for. So yes, I don't mind standing firm and working closely with the author of the legislation to move this forward. And I know I've shared this sentiment to Senator Therese, and I want to make sure, and I hope that my colleagues will share that same sentiment. If the administration is sincere about being open and transparent with us and working closely with us, then they shouldn't have a problem with Bill 333 getting enacted. I cannot say how my colleagues will vote on this measure, but I'm hopeful that they will understand that as we go along with the millions and millions of dollars that we are receiving from the federal government, that there is transparency and accountability for every penny that is spent.
So that sounds like you're going to be voting yes to override that bill.
I think it's important that we all show the community of Guam that it is about being accountable for all the transactions that we do as a government. But we have to do it together, and we have, in the same effort, we have to work together and be given the information that's needed for both the legislature and the administration.
You know, Speaker, it was April 22nd when the U.S. Treasury issued their guidance for the CARES Act funding, and, you know, we all know that Guam received $118 million. And we just saw yesterday the CNMI, they released the breakdown of how they're going to spend their $36 million. So in your meeting yesterday with the governor, her son-in-law, and Carlo Branch, did they tell you, give you a hint, what is going to happen with the $118 million?
Well, I want to share with you, and I know our good brothers and sisters from NMI have again shared with their community that they have done that. We were given information that plan should be rolled out, if not today, we hope, which we thought would be very promising. And I know that she committed to making sure that she worked closely with Lester. I know that the oversight chair of OFB has been pleading and asking and working with the governor's financial team, and I'm very hopeful that information will come to us today, and that's all we've been asking for. I want to share with you, Sabrina and Chris, that yes, on April 30th last week, I did write to the White House, and it wasn't just signed by me. I want to share with you that Senator San Augustine, the Vice Speaker, Senator Pito, Senator Taitino, Senator Jim Moylan, bipartisan support. We sent this letter to Douglas Hosher, which is the Deputy Assistant to the President, and to William Crozier, which is the Special Assistant to the President and the Deputy Director of the White House, that we here on Guam, on this side of the Pacific, continue to be the most patriotic community, and yet while everything is being rolled out in the United States, nothing has come the majority of the programs have not come our way.
Right.
When I'm listening on last week's briefing at 3 o'clock in the morning about Get My Pay for those residents in the United States who hasn't gotten there was a link to double check. I'm saying we haven't even started here. So in that same effort of frustration, I wrote a letter asking, and I just asked my staff this morning, have we gotten an update from them? And they shared with me that just yesterday night, Friday and Saturday, that they were going to give us an answer, and they were just working with the different departments to get an answer back to us. So again, I can only work as far as the information that comes to me, Sabrina and Chris, but in the same efforts, I know this morning I got a plea from a constituent who is a single mother of 3, works at the hotel, doesn't have, has nothing to fend for her kids, what she needs help. And you could hear, the way I was reading it, you could see that she was probably in tears. And I wrote to her and I said, in the efforts of the governor saying that she's going to work a plan based on the information that she gave us, and making sure that we also are waiting for Uncle Sam to tell us when these programs are going to come our way. That I'm hopeful that this week will be a better week than the last several weeks.
Yeah, I think we're all hoping that.
Yep, I hope that every day, that the next day is better than the last. The Speaker, I want to thank you. I kind of want to go back just really quick because we got some other calls on about because the governor had actually sent me some messages about the territories haven't gotten the stimulus, and that's that, right? But remember, we've been asking since kind of the first week, was there anything locally that we could do in the meantime? Because I think a lot of people anticipated that this federal aid was going to take a while to get here. So people were thinking that, hey, this aid's going to take forever to get here. What can we do right now? So I don't think it's fair to let the governor off the hook and say that, well, Puerto Rico didn't get it. I'm not saying you're doing that, but I just know that that's part of what they want, the messaging they want to put out, which is all fine and good. But at the same time, people were asking for you to do something locally, right?
Well, Chris, I must give effort to Senator Regine Biscoli because her plan on the rise was supposed to be that leverage and that support needed to help our local residents. The governor did state that she will be sharing her plan on the press conference today. I've got to believe that in her efforts of listening to us, working with Senator Biscoli and our other colleagues, that there'll be something to that effect to work out. I want to note also, if you guys haven't noticed, because the Triple P, which is the payment protection plan that came out, working closely with our banks, that was a program that helped over 584 businesses that had a multiplier effect of over $1 million. And I must say that Department of Labor, Revenue Tax, and all of the governor's administration that worked on that plan, that gave a positive effect. And I know that we didn't have enough the first round, but since the passage last week, the second round is going out, and I know that the banks that are working closely with this have been are starting to call the different applicants, that the employers and the businesses that already had applied for it since the first round. I also want to note to you that in the efforts of helping our residents out, I talked to the chairman of the Banking Association as it relates to fees and notes and all that, and there was a possibility of making sure that a lot of those things were deferred. And let me tell you, if I'm not mistaken, for Guam's PPP program, 508 to be exact, with over $102,418,246. I think it's already been sent out, and that's being circulated within the community. I was told by 5 different businesses that they've already hired a lot of their employees back, which is probably out of 5 businesses, over 200 employees. I mean, the businesses who really took advantage of this program literally are giving the opportunity for their employees to come back to work. And I'm hoping that this second round that the banks are working with our constituents and our and our businesses, that we will get more revenues back into the community this week. Okay, Speaker, thank you for your time. I definitely appreciate your call. And, keep us posted. The invitation's always there if you want to call and check in and let us know what's going on. Definitely, and as soon as I get a message from the White House, I'll definitely bring it to your attention. Thank you. Okay. Thank you, Speaker. Right. Okay.
Take care.
That's that. Wash your hands. What? Hey, I want to go to line 1 here. We have, now, sir, we're going to allow you to remain anonymous, but just to give us a little background here. You are currently quarantined.
Yes.
At the Pacific Star Hotel, Tony Babauta's hotel of choice.
Yes.
And so let's just start from the beginning. Can you just share your situation?
Okay.
Flying into Guam, sir. Let's just start on you coming back. I'm assuming.
Okay.
Go ahead.
Once I entered Guam, I went to customs and all that paperwork. They took me down to the Pacific Star. Gave me a room and all that. And it's already been 3 days. They've been taking my temperature. It's been good. I requested, why can't I be given a test to find out if I'm positive or negative on the COVID-19? They have no answer.
So you came in. Did you take any tests? Where'd you fly from? First of all,
Hawaii.
Hawaii. Okay. Did you take any tests over there, COVID-19 in Hawaii or anything?
No, I didn't.
Okay. So you flew in. They're now telling you got to be there 14 days. But
Yes.
You're from Guam.
Yes, I'm from Guam. I'm from Talafofo, and I just want to go home. I mean, if they take the test, if it's positive, then I understand. But if it's negative, can they release me so I can go back home and quarantine myself there? Because the only person at my house is my son and I. That's all I'm asking.
Did you talk to Rebecca Respicio or Alice Tyron?
No, I didn't talk to none of them. All I talked to was the nurse, whatever, that's coming around. All they're doing is screening. Every morning they come, they take my temperature. Oh, okay, you're good. The third day, they've been saying my temperature is normal. Then I asked them, can I, get a COVID test and find out if I'm positive or negative? They said, no, you have to go to the 14 days. I said, man, I'm trying to save the government some money. And
I think it's already paid for, sir. They already paid for the Packstar.
Yeah, well.
Are there a lot of people staying in that hotel? Is it full?
No. Just what the last I heard, there's only 142 people here to stay.
Right. Let me ask you, sir. So I know that you follow the news. When you saw that the governor's former chief of staff was able to overnight at Pacific Star because he wasn't feeling well, and then when he woke up, he was assessed and cleared by public health nurses, and you were just hoping that you can get the same treatment, but you're saying, hey, give me a test. If that's what I got to do, give me a test. Lord knows we got a lot of tests.
Exactly. I mean, we would be the main corporate that would be spreading the virus to the island. So why can't you give me a test and let me know where I stand?
I mean, or at least if they let the chief of staff go without taking a test, do you think that they should allow you to have the same type of opportunity, sir?
Yes. I mean, I'm a human being like him, too.
It
Just
sounds
because
like
he's up there and how you say, on the ladder, and here I am, just a retiree, just staying home and trying to live my normal life.
How old are you?
I'm 56.
Do you have any pre-existing conditions, sir? Diabetes, anything, chronic illness?
No, I do not have any chronic illness.
It sounds like you have a sudden loss of taste.
No, I don't have taste. I mean, taste, I still got good taste.
No, sir. Sabrina said that because in order to get tested for COVID-19, you have to have the symptoms, and then one of the symptoms is
a sudden
loss of taste of sense, taste and smell.
Oh, so that's the only time I could get tested is when I have a loss of taste?
Or if you're the governor's chief of staff, they just let you go. They take your temperature, pat your button, and hey, go ahead, run along, go sign some contracts.
Exactly. I mean, I'm a taxpayer and all that, and why can't I be given that same type of treatment?
I can't tell you.
This is what happens when you have one set of rules for one set of people and another set of rules for another set of people. I mean, now we're telling you should just lie, sir. You should just lie. You should say that you have a loss of sense of taste or smell.
Exactly. Does it take that for me to get the test? Or I'm going to say, I'm not breathing good. I cannot breathe anymore.
Let me hear your best cough. Let me hear your cough.
It's not even funny, but
it isn't. But let me hear your cough.
When the second they open the door, I'm going to say, I cannot breathe. Probably they'll see me even quicker.
Well, then you're never going to leave. They're just going to lock you in the room. Don't go in there, guys. Go call Becky and Alice.
Yeah, I mean, it really is just something that is frustrating that I understand. If I am positive, then I will be, I don't mind being quarantined.
Right, yeah. No, this is it. See, Governor, this is what happens. This is an exact effect of you guys allowing this nonsense with the chief of staff. You've called into question the whole procedure for quarantine.
Exactly, and you got people out now that's getting out in the public. They're getting tested. And what about us that's here at the Pacific Star being quarantined?
What would your message be? Let's just put it out there for the governor. I don't know if she listens, but her people do. What is your message to Governor Lulian Guerrero, sir?
Oh, gee, I really don't want to say it, but you know.
All right.
You sure you don't want to say it?
I feel like you want to say it.
I mean, I really want to say so, but you know, we elected you people to do a job, and yet you are not performing the job that is given to you. I mean, I don't want to say no vulgar languages because it's not nice.
Right. Yeah, of course not.
Yeah.
Well, sir, we definitely feel your frustration. We're going to make a story out of this. We're going to put it out there.
Yeah, please.
And
because if I have to tell them how I cannot taste anymore or this and that.
yeah, I wonder. I mean, sir, you're totally right. We're out here testing 200 people here, 200 people there, 200 people there, and there's only 140 in the quarantine.
Right.
But maybe they don't want to test you guys and clear you guys because then maybe the hotel wouldn't be making money anymore. I don't know.
That's what I'm saying. Hey, give the food to somebody else that needs it more than I do.
Or let's get the homeless in this hotel. If anybody can stay there, let's get the homeless in there. What's good enough for Tony Babauta and Alice and Becky, probably good enough for the homeless.
Exactly. But, you know, I hope you guys can let the people know that what I am going through.
I think you're doing a good job of that right now, sir.
'Cause,
And thank you.
I'm just following whatever they say. Oh, you got to stay there 14 days. I keep asking. I said, ma'am, I'm okay. Is there anything else you want me to say? I mean, I really don't want to be telling them I cannot taste and all that. They may say, oh, okay, then you cannot go because you cannot taste.
Well, how much do you miss your family, sir?
My wife is still in Hawaii, and she is coming back to Guam, but she says she's going to hold off until this COVID-19 goes through. And the reason why I came to Guam is because my dad was going to be hospitalized.
And so how's your father now?
He's okay. He went to whatever procedure had to get done.
Okay.
In the hospital, he was released. And, you know, I just would like to be with him. He's already 80 years old, and I want to spend every time with him while he's still here with the family.
Well, sir, I think maybe you should speak with the...
I think I should have Tony Babauta adopt me.
You should have Tony Babauta adopt you, but he's no longer working for the administration, so...
or somebody, or the governor, can you adopt me so I could get the same treatment?
You might want to check Rebecca Respicio or Alice Tyron over there.
Or then if they could adopt me, then probably I could get tested and released.
We're going to bring this up, sir. This is definitely a valid question. I mean, if we're going to test, if we're going to tell everybody out there, hey, come here and get tested, hundreds of you.
Exactly.
Why can't we do the same for 142 people at the Pacific Star? Good question.
That is correct. Please do. And I thank you very much that when I turned on the TV here at the hotel, which they have, I saw your show. It took maybe about 50 times to get answered, but I finally came through.
There's a lot of people calling, sir. Thank you. Hey.
Yes, thank you. Thank you, Sabrina, and thank you there, Chris.
Thank you, sir. God bless you.
Well done.
And we're going to find out about this, all right?
All right, thank
you. Sorry to hear you're having a loss of taste.
Yeah, really, I mean, you should get that checked, sir, that loss of smell,
I believe so, because I cannot even taste the water anymore.
When they come into the room, just say, Lana, don't do in here. Do you guys smell that? Because I cannot smell anything.
Probably.
Okay, sir.
All right, okay, thank you.
There you go.
Take care.
Thank you. Bye.
Wow. Boy, the wheels are just coming off. The wheels are coming off.
Oof.
What's up, Talafofo? Wow. I just need a second to just, whoo, boy. That was...
I know. Got a feel for him, he really wants to go home. I mean, we do have to understand that, It is a mandatory quarantine, 14 days. But a lot of things aren't making a whole lot of sense
Right.
these days.
Yeah. And you know what? Hey, they're going to try and fool our people from the South. We are sharp. You know what I mean? In the South, we're pretty sharp all over. People of Guam are paying attention. And you see it in the comments, like the level of how much you guys know what is going on. I love it so much. I think that this is how it needs to be every day. Even without the COVID, we all need to be so invested in all of the actions our government is taking. Because I'll be honest with you, the reason why they're acting like this now is because they feel like you guys weren't paying attention then. So let's just keep this this focus and this heat on here. And we're going to take a little break. We got Hannah from Department of Labor. We've got to try and squeeze in a bunch of people before the end of the show here. It's the KUM News Takeover of Guam's favorite containing COVID.
Can you guess?
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank, and Coast 360 Federal Credit Union. Together, we thrive.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
GU Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus, gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
With the new challenges we're all facing, First Hawaiian Bank wants to make sure you have access to your financial world. With FHB Online and our mobile app, we hope to make banking the least of your worries. Visit fhb.com/digital.
Be healthy. Be informed with ITD.
This war against COVID-19, it's going to take all of us to do our part.
We are all frontliners in this epic battle.
And on Tuesday, May 5th, we're asking you to answer the call to help by taking part in Giving Tuesday Now.
It's part of a global initiative to set aside this one day for the pandemic crisis.
To step up and give a donation to any of our island's nonprofit organizations,
the hospital, the Mayor's Council of Guam, or any of our frontline workers. Whether it's PPEs, gloves, masks, canned goods, no donation is too small. Anything and everything will help.
And if you make your donation, take a picture, post it on social media, and use the hashtag GivingTuesdayNow and GivingTuesdayGuam.
And then later that night, make sure to tune in for our half-hour special Giving Tuesday Guam, Together We Give. We'll showcase how everyone is taking part.
Good morning. It is the KUM News Takeover, Guam's favorite. I woke up this morning, I was like, wow, this is going to be a day of reckoning. And it's kind of looking that way. Adelup definitely has their work cut out for them today. I think Lieutenant Governor kind of made some strides in standing in and answering the questions that we had to ask. Some of them he couldn't answer because, interestingly, as our elected Lieutenant Governor, the second most powerful elected official in the island, he doesn't know about some of the stuff that's going on with the procurement of these hotels. But what he does know is he said that's not the way you do it.
Yep.
And so we got to wonder now, obviously, if the governor's legal counsel is the one who's leading this effort, is there going to be anything done to hold him accountable? Because, Lieutenant Governor and people now are wondering, like, is this going to be able to survive scrutiny by the federal government? We don't know. And like the Lieutenant Governor said, that's something that we're going to find out as this issue.
Right. And FEMA's not joking. I mean, they said you need to demonstrate there are mechanisms in place to justify every single expenditure for reimbursement. And
right.
It could result, if you don't have your act together, it could result in not reimbursing you for everything.
Right. And so, man, that's a bridge we're going to have to cross. But in the meantime, people got a lot of questions about it. You know, something else people got questions about, of course, the FPUC and the PUA unemployment, programs here, assistance. And we have Hannah Cho from the Department of Labor And good morning, Hannah.
Good morning, Chris. Hi, Sabrina.
Hi.
So I guess we just want to give you the floor. There is an update with Department of Labor and these pandemic unemployment programs. So what is that update, Hannah?
Well, today we launched our phase 2 of the unemployment process, which is now employers that have registered on HireGuam.com are now able to go back in and start inputting the data for their employees that have been laid off, furloughed, or had their hours reduced due to COVID-19.
You mean like their employees' names and things like that?
Yeah, it'll be all of their information, their wages, the dates that their furlough began or their reduced hours began, and all of that information so that we can eventually use that to dual verify when the employee module goes live, and then we can get our people their money.
Okay. Is there any update on that yet?
On what?
On the any further guidance from USDOL?
Right now, on April 28th, we did send our budget request to the federal government. We're requesting just over $924 million, and that's to cover both programs, PUA and the FPUC. One of the holdups is that we don't have a signed agreement for FPUC yet. We have one for PUA, but we don't have one for FPUC, and without that signed agreement, we can't really go any further. But, my director, David Della Sola, he's trying to be proactive, so he combined the two requests into one and just sent it in anyway so that we can try to help our people. We're trying to get the application process set up and verified so that when the federal money does finally come in, we'll already have people that have qualified and we can start issuing checks instantly.
Wait, so the $924 million is inclusive of the FPUC?
Yes, it's for PUA, FPUC, and minimal administrative costs.
All right. And you're still waiting for approval on the FPUC. Wasn't that, what do you mean when you say that?
So there has to be an agreement, like kind of a contract, I guess, or an MOU. Well, not an MOU, but so there has to be an agreement between USDOL and Guam DOL for these programs to actually exist here on Guam. So SPUC, we're just waiting for signature.
But we've already been approved by USDOL to implement that we're eligible for the FPUC.
Yes, that is correct.
All right. Okay. Is there a deadline for these businesses to start registering all their employees?
It's not necessarily a deadline, but they should start doing it as soon as possible. And again, I do want to remind those that are self-employed to not register yet, because under this system, the self-employed will be considered employees. So when the employee module goes live, then those that are self-employed can register on the website.
Right. Hannah, so we've been telling people, as per Dave, to send their info to Rapid Response at Guam DOL. That's still, so you have all that info, and if people are still sending that info in, can you take that out from there and then put it wherever it needs to go?
Most of that was necessary so that we could estimate how much money we could request from the federal government.
Nice. Okay. So, and I mean, yeah, because people are asking me, but I know we haven't, when we come out with the application, that will really, really be the official beginning, and that's how you get in and all that.
Right. I mean, I just got off of a conference/training regarding PUA and FPUC with the federal government. My director was on that as well, and they walked us through the process and some of the rules and regulations. And one of the main things that they said is everybody has the right to apply, because there are so many questions about eligibility and whether you qualify or not. So everybody has the right to apply, and eligibility can be determined during the application process.
Okay, good. All right. Thank you, Hannah. Hey, we got your number. I know Dave's busy. That's good. I'm glad. So if you're available, we'd like to get you.
He's talking to the feds all the time.
Right. Good. Yeah. That's good. So if you are available.
You guys got me.
Right. Yeah, that's fine. That's great. Yeah. You're a little better looking. I just didn't want to insult Dave. Okay.
Hey, this is radio. You can't see me anyway.
We need you to send your pictures since we're going to be talking to you more often.
Send a pic, okay?
Oh, also, I sent you guys some info sheets. Chris, I sent it directly to you that you can post if you want. It has some FAQ information and just a little bit hoping to help the people better understand the
Right.
situation.
Thank you.
And
We'll,
give them a little bit more information.
we'll get that up. Thank you so much, Hannah.
Thank
Okay,
you.
You're welcome.
Okay, right
Thank
on.
you.
Okay. We'll see you. Wash your hands.
I knew you were going to say that.
Okay.
Bye.
Well, if anything, I'm consistent. 949 containing COVID. Again, there are just so many ways to reach the show. You can stream it live on KUAM.com. It's also on the KUAM News app. And we have an audio stream, Docomo Channel 10, as well as KUAM TV 11, where our show is being played in hotel quarantine. Over there at Pacific Stars, we had heard from a gentleman who is in quarantine, demanding that he be tested. And Bree, can we go over the numbers real quick for the...
Sure.
Thank you. So the
Okay,
latest
so-
again, COVID-19.
So over the weekend, a total of 250 tests were conducted, and a total of 4 returned positive, bringing the total number of confirmed cases of COVID-19 on Guam as of Sunday night to 150. The samples were from clinics, hospitals, the quarantine facility, and expanded testing at Hemlani Apartments in Harmon. We should note that all of the samples that were taken at Hemlani were negative. Additionally, according to the Joint Information Center, at least 6 people who had initially were determined to have recovered from COVID were retested for the virus and are back on active isolation status after testing positive.
Okay, 9:51 here. Let's go to the phone. She's been on hold. Sorry about that, Senator. We wanted to get that update from Labor on, but Legislative Health Committee Chair Senator Theresa Lahi. Good morning. I don't know if your ears are burning, but people have been talking about that transparency bill of yours all morning.
Good morning.
Good
Sabrina and
morning.
Chris, and thank you for all I've heard this morning. It's really been a great show. Lots of information, and I think I can't thank you enough for the information that you actually get out there. And thanks for actually reminding everybody this morning that we've got an override pending, I'm hoping, on this transparency bill. And we're going into session tomorrow for that purpose. And I'm really hoping that, I want to thank the people of Guam actually for their support. We've received a lot of support, and I think the senators have, heard a lot from the people. And I think a lot of that thanks to the media. So I want to thank you for getting the information out that I've always believed the more information the people of Guam know, they're very smart. They're going to know what to do with it. So I think we're seeing now that, when people are suffering, especially, this is unprecedented type of, being unemployed for so long. You've got children in your house, and there's so much pressure. So I just think that transparency now from the government is so much more important. We can't skip it. We can't shortcut it. It's just got to be all out. And so I think we have to justify, when we're going to spend this COVID federal money, how we prioritized, putting it towards any government agency versus putting it towards food, or, whether we, through the agency, put it towards food, housing, just cash assistance for these households. All of that is extremely important right now, and especially because we are looking at severe deficits on the government of Guam side, that we cannot do those things, right? That we are going to be very limited in what we can do on the government of Guam side. So of course it's very important. That's why we've been demanding a spending plan, an expenditure plan. I think that's reasonable to ask for these things. If we can get a plan in advance, we can weigh in on it instead of criticizing later, right? We can give our best suggestions. We can help. And I don't like to be critical of the government. There's nothing you can do after the fact right now, right? But we've got people. One of the issues is, show us a plan. Then when you spend it on hotels or whatever we spend it on, we're all in it, right? Otherwise, we're going to do like what we are doing now, and we're going to question whether that procurement was proper or not. And those things, bring us back to the days of, I call it the old school politics of where we're always worried about corruption. And that's unfortunate. It's really unfortunate in the middle of a health emergency. So I just hope we can all get back on the same page, with this override, and that, we're going to all work together. It's imperative. All of us, media, public, the governor's office, the legislature, every agency on Guam needs to be able to stand up for themselves as well. They cannot let these things happen. We can't, we can't think that our directors who we just confirmed are going to let corruption happen on their watch. I'm going to ask them straight out on your show right now to stand up, and they can't let that happen. So
stand up. Whoa, we need a new PSA.
Bring your own wand.
Wand, right on.
Right. Thank you, Senator. We got to run. There's a couple more calls we want to get in.
I appreciate it. Thanks.
All right, take care.
And thank you again for everything you did this morning.
Wash your hands.
More information.
Okay. All right.
Senators, they go into session tomorrow, right? Is it 10 a.m.?
Yeah, let's get Senator Moylan. Are you still there? We got just a couple minutes before we end on a good note here, and I don't want to screw that up. So I know that, are you calling to talk about the interim unemployment assistance?
Absolutely. Actually, I'm on hold to make a plea to our governor to pay out the funds now, the relief funds now. So the governor has the authority in the Organic Act on how to expend the federal dollars. And she made it very clear on several occasions. So what are we waiting for? The governor already has received $117 million from the CARES Act, as well as federal funds for the agencies. So we know that these monies are available. That's clear. So let's use some of these monies now to help those whose jobs were impacted. And the Treasury Department instruction says it can be used for that, to provide them the support while they await the federal relief. Right? This $117 million is totally separate money from the PUA account and from the stimulus 1200. It's already in the general fund, and it's sitting there. And if we don't take some action now, it's going to disappear. So if we don't use the monies now, I just fear, really, in a blink of an eye, it's all gone. While today families are struggling to place food on their tables, so let's help them. Pay the funds now, Governor. And I really plead for that. I have a bill that's probably not going to be on tomorrow's agenda, but I'll
probably not ever.
Probably not ever, right? Forever, right? But I'll fight for it. But the point is, we can use this money already. It's separate again. I just want to stress that. It's totally separate. I know our agencies are working really hard to get all those agreements they have to get in place, and they're providing us the best updates they can, from DRT to GDOL as well. And to Hannah, who recently gave that information to, that's all really helpful. They're on it. I get it. And I appreciate that. But today, the governor has $117 million that she can use. Pay out something today. That's my plea to the governor.
Have you heard that might be happening? There's some kind of the press conference today, something might be released?
Well, then thank God. I'm glad I went in front of Cathedral yesterday and did my prayer. So, and if that's the case, then that's the right thing to do, because the U.S. Treasury of Guam said we can use this money to provide economic support for the unemployed because of COVID-related. And it stresses that, fund payments must be necessary and expenditures must be reasonable and intended for reasonable judgment of government officials responsible for spending these funding. Who's going to argue that you can't give it to the people to pay for their needs, to help them buy food for their kids and their families?
All right, we hear you. Yeah. I mean, I think we've been saying this.
Yeah, and also, Senator, there's an allowance in that guidance where they could use it for food assistance as well.
Yes, you can. We've seen that done before.
But who's reading stuff at Adelup? Like, you guys don't know this over there at Adelup? Maybe they're too busy writing, procurement letters, or stamping Linda's signature on everything, because it kind of seems like we all knew this since April 22nd. It's May 4th.
Right, and absolutely they're not reading my multiple letters, but that's okay. but I'm just making a plea on the air with your listeners and everybody out there. Please, Governor, release the money to help the people today. I beg you.
Do you have the right zip code, Senator? Maybe you're putting Dedito's zip code.
I got these pigeons outside. I'm going to try.
Oh, he's going to try pigeons. There you go.
Yeah.
You're going to go the Mike Tyson route. Okay.
All right, Senator. Thank you so much.
Thank you.
All right.
Right on.
Take care.
Wash your hands. Okay.
Pay it now.
Pay it now. Yep. Paid yesterday. All right. Man, this has been quite a show.
Yeah.
There's just, I'm actually scared for it to end, because that means we got to get to work on all that stuff that happened in the last 4 hours. And I'm just like, oh my God. But definitely, wow. The wheels I think the wheels are all the way off.
Yeah.
People are calling out the governor's son-in-law and legal counsel. I think that, I'd like to see him at that press conference. I mean, that'd be great. 9:59. But Bree, as we always do, after all of the stuff that happens during this 4-hour extravaganza, we always try and end on a good note, okay? And our good note today is, I believe it was last week, we had Anti-Zita from the Guam COVID-19 in Jotnia, and the place is broken into, totally trashed. They had even set some fires.
It, yeah.
Right. And
if you don't know what the Guam COVID-19 is, it's where traditional healers practice their craft.
Yeah. And so we actually had something happen with a group of federal firefighters now. And we're going to bring one of them on. And they actually did a great thing. We're going to pop it up on our Facebook live feed for you guys. But we're going to bring on, are you a firefighter? What's your rank there, CJ?
Good morning, Guam. Yeah, I'm a firefighter down at Big Navy.
Okay, so yeah, Big Navy firefighter CJ Terlahi's on the line. Can you just kind of tell?
I know CJ Terlahi. Hey, CJ.
Is that Auntie Zita?
That's Auntie Sabrina. Are you an auntie?
Hey, how you doing?
Hey. You could call me Auntie.
She's like, you can call me whatever you want. No, but CJ, just take us to the beginning. I'm sure that you heard the news about Guam COVID-19, and then when did you guys decide that you wanted to do something about this?
Well, so actually, we heard about it through, first and foremost, I'm a Junior resident, so, I'm on the neighborhood watch, and, we see all these sad moments, so we as an association wanted to reach out and kind of assist, one, because I'm from that area, and secondly, we started a firefighter association, which is called AFFF, which stands for Association of Federal Firefighters. So we're still in the beginning stages of this association, but our main goal really is to go out, kind of help the community, especially during this pandemic. Everyone's, we're all in it together. The struggle is real. All of us are struggling together. So as a community, we wanted to come together, and as a Federal Fire Association, we wanted to go out and help Anti-Zita and the whole Guam COVID-19. So we actually heard about it through one of our other fire captains. His name is Fire Captain Jesse Cruz, and he's also a Junior resident. He went out there, started water blasting, and just did his part. So we heard about it through him. We wanted to do our part, so we reached out to Anti-Zita, and we just donated a few things just to kind of get the ball rolling. Any donation will help. So that's really our main cause and our main goal.
It looks like, were you guys water blasting and were you guys painting?
Yeah, so we actually purchased a few items, paint, roller brushes, just to get, the building back up. I'm sure it's going to take a while, and it's kind of unfortunate that, things are happening. People are still vandalizing and breaking in during this time. It's kind of sad, So we just wanted to do our part. But yeah, we just got a few items, just to kind of get things started.
Okay. So you said you were a resident of Jotnia. So do you guys have any kind of inside word on who you think may have done this?
Man, to be honest, I really don't know. But I hope these people are actually listening in and watching. Because this is it's devastating to the community, to Guam. We don't need this during this time. People are already feeling the hit from the pandemic already. So. To add this on to everything that's going on, it's kind of sad,
Right. Yeah. Well, we just wanted to bring you on, CJ, and to recognize your brothers and sisters in fire, and to just give you this platform and let people know the good deeds that you guys have done, and to also just let the federal firefighters that did this know they are our COVID heroes for today.
Oh, I appreciate it. Thank you guys for having us on. Once again, we're in the beginning stages of the AFFF, which stands for Association of Federal Firefighters. We actually just started the end of this past year and the beginning of this year. So we're going to be starting a Facebook page, Instagram page. Our president, Captain Joe Moffness, has really reached out. This is not our first kind of gig, to help the community, but contact number you could get him at is 787-4151. Once again, that's 787-4151, and that's the president of our association. His name is Fire Captain Joe Moffness. And anytime you see us out and about, we kind of work hand in hand with Gov Guam, Guam firefighters, ARF, Anderson, we're all in it together,
Mm-hmm.
So we're just trying to do our part and help the community.
All right. Thanks, CJ.
Okay, thank you guys.
Okay.
Hey, God bless you.
Be safe.
So I wonder, do you guys get a lifetime discount on traditional healing now that you?
You know what? I hope that's part of the deal.
Right. Oh, Auntie
Okay,
Zita's
thank
a
you,
great
guys.
lady. Hey, thank you, CJ.
All right, Chris.
Wash your hands.
Okay.
With the fire hose. Sorry. All right. Bree, good job today, Sabrina.
Oh, good job to you.
No, good
And
job to
Joe.
you. Yeah, and to Joe, sir, to Ken Sanity, our digital team, to our whole KUAM News team, but really, most especially, I want to echo what I've been saying all morning. You guys are great out there. The way everybody has stepped up, when they told us what we could expect, what could happen with this COVID-19, the people of Guam, we took that knowledge and we empowered ourselves to do what we needed to do. Okay, and here we are today, and you guys are just so on it. But kind of like what Senator Theresa Lai said, when our people have the right information, and they always should have it. You guys are just smart. Nothing is really getting by you guys, and I totally love that. So thank you guys. You are our COVID heroes. You know what? You guys are COVID heroes too. You good, Bree? Because I'm going to play our song.
Sorry,
and then we're
yes,
out here.
sorry.
Okay,
Just
just
my
a lot.
messages. Thank you, everybody, for watching and listening and streaming us. Really appreciate it.
I'm
and for
just
your
laughing
input
because
and-
Bree got her we got a lot of work to do. Boy, you better end this. Play your song. Do what you got to do. Let's go.
No. Yes.
Yeah. Okay. I know you.
Catch the press conference at 1 o'clock. We're expecting for you to get an apology.
Right. Yes.
And also some, it should be interesting if they're going to reveal their plans.
I think they're gonna do something to make you forget about all the nonsense.
There's no way you're going to make people make everything disappear.
Yeah, it's
not
still gonna be
possible.
there, right? So.
Yeah.
Hey, that's happening. We don't know the set time, but you just keep it where you got
It's
it.
1 o'clock.
It's 1 o'clock.
Well,
so-
you're right. We
Yeah,
don't know.
we
It could
don't
be
know.
1:30.
Okay, so for Sabrina Salas, Matanani, Guahusi Chris, thanks for listening so much. Hasta, Joe.
Bye.